Okay, dear ladies and gentlemen, welcome to our regional roundtable on research needs and opportunities in Africa for national implementation plans under the Stockholm Convention. And my name is Anastasia Butrok, and I'm pleased to welcome you on behalf of Green Growth Knowledge Partnership, GGKP, which is hosting this event today as a part of Global NEP Update project, GEF-ID 10785, funded by Global Environment Facility and led by UNEP. And through this project, 32 countries, they are currently reviewing and updating their national implementation plans, NIPs, and nearly half of them are from the African continent. And while these countries are making significant efforts to collect and compile the data on persistent organic pollutants, we recognize that many face challenges in advancing beyond Tier 2 of the POPs inventories. And largely, this is due to the limited data availability or technical institutional capacity constraints. And the idea of today's roundtable originated during the regional training we co-hosted with the BRS Secretariat in Kenya in November 2024, where ECP was was a host to this workshop. And after that event, which included the valuable insights from the researchers focusing in Africa, we received a very strong feedback from our countries, emphasizing the need for more exchanges between the scientific and the policy communities. And we also know the BRS Secretariat is actively working to strengthen the science policy interface. So this roundtable aims to contribute to this vision. And today's discussion is intended to warm up the dialogue between the science and policy. So science meets policy today in the context of POPs research and in Africa. We are also pleased to feature presentations from the national governments, Stockholm Regional Centres, research groups, institutions, laboratories across the Africa continent. The session will be moderated by Dr. Roland Weber. I believe all of you may, and most of you may know him, a leading international expert on POPs, who has kindly helped bringing together all the speakers and stakeholders you will hear from today. Many thanks to Roland. And a few quick housekeeping notes. Event is in English with interpretation available in French, Spanish, and Russian. Please feel free to select your language. After the presentations, we will open the floor for discussion. So if you would like to join this dialogue, please feel free to raise your hand in the end of this discussion to be promoted as a panelist and speak with the other panelists. So you may also submit your questions as a text in the chat box or Q&A box, and we'll kindly ask that you introduce yourself when doing so. Finally, please note that the session is recorded, and both the recordings and presentation materials will be shared with participants in a follow-up email and on the project's website. And thank you again for joining us. We look forward to a rich and very engaging discussion. And over to you, Roland. Thank you very much.
Yeah, thanks, Anastasia. Good day, everybody. Good day, everybody in Africa, but also outside Africa participate. The topic of the last conference of parties last May in Geneva was making visible the invisible. Here, research and especially analytical chemistry and monitoring are important tools to make visible the invisible. There are a range of gaps, especially in low and middle income countries, including African countries, on POPs research and in particular in analysis of POPs. So today we have brought together 12 distinguished speakers on the topic POPs research needs and opportunities, where we hope to initiate a dialogue between countries and research groups with research needs and groups also with research opportunities, and progress here the development of a network on POP researchers and research groups in Africa and beyond. So we start with Mr. Agustin Harte. He is from the BRS Secretariat. Agustin, you can share your slides. He's
Thank
member.
you very much.
Yeah, you're welcome, Agustin. Yeah, please, the floor is yours.
Thank you, and it's a pleasure. It's a pleasure to share this roundtable with all of you. My name is Agustin, as Roland presented me. I'm part of the BRS Secretariat, working specifically on the Science and Technical Assistance branch. And in these few minutes I would like to bring some of the perspectives from the Stockholm Convention work that we are developing within the Secretariat. The mandate, I'm sure you know the Stockholm Convention already by heart, by memory. And I would also like to focus on some of the current work that we are developing to promote science to action and to enhance environmental decision making under the conventions based on scientific knowledge. So I will share the slides with all of you later, and you will have the links to the different web pages and documents that I will be sharing with you. Of course, I would like to start highlighting the topic that we are here discussing is national implementation plans. And this is an obligation under the Stockholm Convention, specifically on Article 7, where every party to the convention has to develop and make the efforts to implement national implementation plans to fulfill their obligations under the Stockholm Convention. And for that, the Stockholm Convention provides recommendations, including a wide consultation among national stakeholders, including the scientific community, including other industries and social actors. And the development of these NIPs, of course, have to be transmitted to the Secretariat for consideration at the Conference of the Parties and reviewed and updated periodically. And this is a topic I'm sure you have been discussing in the past. Every 2 years, we have a Conference of the Parties. We have new obligations, new chemicals being listed under the convention, and we'll touch that point in a minute. So countries will have to deal with these new obligations, with these new challenges, and reflect those in the periodic updating of their NIPs. And we know that every 2 years there's new chemicals, new inventories to be developed, and this has been, of course, a challenge. And this is why kind of projects, for example, that the one that is gathering us together has been supported parties on national governments and focal points to develop and update these NIPs. And an important aspect is that the national implementation plan should not just be a document to be presented to fulfill that obligation, but actually has to be integrated in the policy, in the environmental policy of each country. And of course, there are plenty ways of doing that: national legislation, national strategies for sustainable development or for environmental management. Each country will need to determine how this action plan is integrated into their policies, into their regulations, and into their actions. And of course, within the Stockholm Convention text, there are other aspects that also refer to the development of national implementation plans. I will briefly mention some, for example, polychlorinated biphenyls, as known as PCBs. The Stockholm Convention also states that countries have to develop a plan to achieve the targets on 2025 and 2028, and the PCB elimination targets, and this should also be part of the national implementation plans. Similar to the unintentional POPs, where parties have to make determined efforts to reduce and eliminate the releases of unintentional POPs by implementing best available techniques and best environmental practices, and these inventories of UPOPs and strategies to reduce their emissions and releases should be also part of the national implementation plans. I'm leaving here the series of COP decisions and links to the reference documents. When developing the NIPs, I'm sure you have discussed, there are plenty of tools that have been developed by the Secretariat or by other agencies, including UNEP. There are a sort of guidance documents regarding development of inventories, identification of alternatives, the management of POPs and the releases of UPOPs. I give you as well the link to all of the documents and tools that not only BRS Secretariat, but other partners have developed as well. An important aspect I've heard today that there are 32 countries updating, developing their NIPs. Once this is done, the final step before starting implementation, of course, is to transmit this to us, to the Secretariat. The usual person working with us on the NIPs was Suman Sharma. He's now retiring, so the new person appointed to work with all of you on NIPS is Carla Valleclan. So I leave you her email so that you have her contact. And I'll just put an example of Kenya on how the information on the NIPS that have been transmitted to us is reflected on the website. There's a specific section on submissions from parties, and you can access to all the original and the updated NIPS on our website as well. This is public information from every country. And just to give you another example of how we use information in NIPS, this is a PCV database, and here you can see how much tons of PCVs have been inventoried, eliminated, exported, and part of this information is extracted from the NIPS that we receive from each country. So we know, for example, that there are around almost 300,000 tons of PCV inventory, and this has been reflected in their national reports and also in the national implementation plans. And I want to highlight an aspect that is important, that the information in the plans and the national reports, which are due every 4 years, is consistent so that we can see and assess the progress that countries have done, for example, on elimination of PCVs or any of the other POPs listed under the Stockholm Convention. I want to highlight, because this is a meeting to discuss how we link the research and the scientific knowledge to the policy. There's a specific article in the Stockholm Convention, Article 11, on research, development, and monitoring, where this is reflected, and parties are requested to cooperate and enhance the capacities at the national and international level to develop research, monitoring, and cooperation on technical aspects regarding persistent organic pollutants, including a whole list of aspects such as assessing resources and releases to the environment of POPs, the presence and trends in humans and the environment, how the POPs transport through different matrices and they transform into different chemicals, effects on human health, socioeconomic impacts, and methodologies, of course, of obtaining harmonized information that can be comparable within the countries and within the regions. And for this, development of national and regional programs and networks is key, and we know there are already a few ongoing at the global scale, strengthening the national capacities, specifically on the scientific and technical research, institutions, universities that cooperate and provide information for decision makers. And of course, making this publicly available so that everybody can have access to all of this information. For this, within the Stockholm Convention, we have the Global Monitoring Plan on POPs, which is an ongoing effort of many agencies and stakeholders to put up and to assess the effectiveness, to support the assessment of the effectiveness of the convention by assessing the levels and trends of POPs in the different matrices and the environment. I leave you here the link to the repository, the warehouse with all the information of past activities of the GMP is available. And my UNEP colleagues have requested for me to also share with you the good news that we have established a new global chemicals monitoring programs. This is funded by the GEF. And this program has the objective, of course, to continue providing global monitoring of POPs, and now also mercury has added so that it can contribute also to the assessment of the effectiveness of the Minamata Convention. And this program has been recently launched. It's in initial steps of developing the regional activities and will comprise, as you can see, many countries from all regions Caribbean, Latin America, Africa, Asia, and the Pacific, with the aim to start activities next year, early 2026. So UNEP is providing the global coordination for this program, and I'm sure that this will support many countries on assessing the levels of POPs in the environment, the impacts on health, and of course at the global level to assess whether the Stockholm Convention has been effective or not to reduce the releases and the damage caused by POPs. Just to finalize, we do have within the BRS conventions a program from science to action. I invite you to have a look at the publications of the roadmap with several activities and recommendations for each party to enhance the interface, the science policy interface, and with concrete examples on how this can be achieved, and this can be done at the national, regional, and global levels. And as I was saying, we also have requisite of public information awareness and education, Article 10 of the Stockholm Convention. So this is also an important aspect covered by the Stockholm Convention. To finalize my presentation, I just want to share some of the outcomes of the recent Conference of the Parties, which took place a month ago. New chemicals have been listed in the Stockholm Convention: long-chain perfluorocarboxylic acids and medium-chain chlorinated paraffins have been listed. These are two complex groups still being used for some purposes along the supply chain. These are industrial chemicals, and we know that for many countries, not only the ones that are producing it, but also the ones that are importing articles which may contain these chemicals, will be challenging to identify what are the uses, what are the articles and products that may contain, develop their inventories, and also the action plans. For UB328, there was a new specific exemption added for these adhesive tapes that is used under the aircraft industry, and an assessment of ongoing exemptions, including PDEs, and polychlorinated naphthalene, and PFOS and PFOAs was also done. Apart from these new listing and amendments to the convention, we have our usual assessment of old POPs like PCBs, DDT, VDEs, where new guidance documents, new reports were presented, and in some cases, for example, on DDT, the continued needs of a specific exemption for control of malaria vector was discussed as well. New guidance documents were presenting specifically on best development techniques and best environmental practices developed in collaboration with the roster of experts on BAT and BEP. So many new guidance, including, for example, management of contaminated sites, were presented and welcome at this COP. There was also a few guidelines under the Basel Convention on the management of environmental sound management of POP waste that were also agreed. And regarding specifically on NIPS, the guidance on inventories and alternatives of newly listed POPs were welcome. And for the newly listed POPs, the Secretariat will work now in the upcoming months to develop also guidance on inventories. So many new documents that will be available for you to look at, and to also start thinking. You are finalizing an exercise of updating NIP, but this is a continuous and ongoing effort, and this is one of the messages I want to convey. The work continues, and new challenges are coming every time we list a new chemical. And I think I'll stop there. I'm happy to respond to any questions at the end, and looking forward for the discussions. Thank you, Roland.
Yes, thank you very much, Agustin. Yeah, new POPs listed means also new monitoring challenges. Yeah, especially medium chain chlorinated paraffins are complicated to monitor, but also the long chain fluorinated alkylated carboxylic acid. Maybe one addition to the global monitoring plan. If I'm correct, I heard that in this plan this time there will be more capacity building on monitoring of POPs in the global south. Yeah, and also that, let's say, more monitoring is done possibly in the global south. Yeah, thanks.
Yes.
Our next speaker is coming from Africa. It's Dr. Subramanian Sevgan. He is a principal scientist from ICP in Kenya, which is at the same time the Stockholm Convention Regional Centre. I have been there last November and I was really amazed on their capacity, analytical capacity. So Subi, over to you. Are you online?
Thanks, Dr. Roland, for the introduction, and also thanks to Augustine for the previous talk, and to the GGKP for inviting us to make this presentation. So this presentation, I'm trying to basically introduce ICP and its capacities, both in terms of the human resource that we have, and also in terms of the instrumentation that we have for environmental monitoring. Largely, we have been using these for our research needs, but we would like to expand the scope to areas in terms of supporting countries in monitoring their environment. Can we move to the next slide, please? Just a quick introduction of ICP. It's an African Center for Excellence, purely on insect science and its application. And we are an intergovernmental organization with charter signed by 13 countries worldwide, and we have more than 571 staffs belonging to 30 nationalities. We do a lot of capacity building, especially research capacity building for insect science-related areas. At any point of time, we have around 200 graduate students annually trained at ICP, and we partner with more than 300 partners. So this institute was started off by a visionary entomologist from Kenya, Professor Odhiambo, who was followed by the World Food Prize winner, Professor Hanseren, then Christian Burgomeister, then Dr. Segenet Kelemu from Ethiopia, and currently our Director General is Dr. Abdul Tinkwanu from Burkina Faso. Next, please. So we are a 100% solar organization, and we are also recognized by various global bodies, like we are the FAO Reference Center for Vectors and Vector-borne diseases, animal diseases. And as Roland indicated, we are a Stockholm Convention Regional Center for POPs mitigation here, World Health Organization SAFRO partner for vector management, and World Organization for Animal Health also recognizes as the collaborating center for bee health in Africa. Next slide, please. Yeah. As the name goes, International Center for Insect Physiology and Ecology, we do most of our researches around insects and how insects interacts with the plants, animal, human, and the environment, and try to see how we can manage insects. When I say manage insects, controlling harmful insects by sustainable ways, and also by looking at beneficial insects and how best we can harness them for ecosystem services is a motive for the larger food security in the continent. So these are the 4 thematic areas on which we work, and there are several research support units that support our work: the behavior and chemical ecology, molecular biology, bioinformatics, data science, socioeconomics, biosystematics, and others. So for this talk, I'll be focusing mainly on the behavior and chemical ecology unit, which supports a lot of our analytical needs. And I have with me the chemist who works in the unit, Dr. Xavier Chiseto is one of the participants in this. Yeah, next one, please. Yeah, within the behavior and chemical ecology unit, our focus is to understand chemical interactions between pests, crops, and their environment. We also try to identify, formulate, and evaluate pheromones. Pheromones are chemicals by which the insects speak to one another, and also chiromones, where it communicates with the plants, alamones, hormones, mediating insect arthropod behavior. And we also look at developing environmentally sound methods to reduce and suppress target pests and increase beneficial insects. And we analyze and characterize insect-based products such as honey, nutritional profiling of edible insects and their products. And we also test for chemical residues in the environment largely within the research mandate. Analysis of pesticide residues and other contaminants are some of the areas which you look at. Yeah. Next one, please. So in terms of the human resource, this is the team that is there in the Behavior and Chemical Ecology Unit. It is currently headed by Dr. Merit Getahun, who is a livestock chemical ecologist, looking at livestock pathogen vectors, interaction at the interface of chemistry, neurobiology, and behavior. Dr. Xavier Chesetu, who is with us, is an organic chemist, and his focus is also on synthesis and food chemistry, especially focusing on edible insect products. Dr. Cynthia Modulangu is a postdoctoral fellow with focus on extraction and characterization of new bioactive compounds. Dr. David Chuasi, he's an entomologist with keen interest in chemical ecology. His interest is on chemical ecology of malaria, arboviral disease vectors, and disease transmission. Dr. Emmanuel Tamiru focuses on plant signaling and insect-plant interactions and chemical ecology of cropping systems. And Dr. John Bire is a natural product chemist focused on bioprospecting and product development. Professor Baldwin Toto, who was leading this unit for several years, retired last year, but then he still contributes into the team as an emeritus scientist, and he is a well-renowned chemical ecologist with keen interest in organic chemistry, also chemical ecology of disease vectors and crop pest. Let's move on to the next one. So here I'm trying to present our instrumentation capacities. We have good instrumentation for entrainment of volatiles, both within the lab and also portable volatile collection equipments that we can use for collecting some of these volatiles or analyze the gas, analyze them in the field. And we have a series of chromatography equipments, gas chromatography, GCFID and GCECD with thermal desorptions for screening of matrix interferences before the GCMS analysis. Next one, please. We also have the GC mass spec for targeted analysis of pesticides, organochlorines, DDT, chlordane, industrial chemicals, PCBs, HPB, and byproducts of these chemicals like dioxins, furans, for screening only, and also other chemistries that you can find in the environment. These are equipments great for molecules at ppm and ppb levels. And to analyze liquids, we also have liquid chromatography and mass spectrometry, especially the LC kit of MS and also LC Orbitrap MS for analyzing industrial chemicals as listed here, and also for analyzing untargeted chemistries. Yeah. Next one, please. Apart from this, we also have the LC tandem mass spectrometry for analysis of quantification of LCM amenable pesticides. And we have inductively coupled plasma mass spectrometry, ICP-MS, for heavy metals and other elemental analysis. Next one, please. As I indicated, our focus is also on understanding the nutrition value of insects and their products. We have the instrumentation required for nutrition analysis of various products. And we also try to see how insects interact with these chemistries through various equipments, the GCEAD and GCSSS, which can reveal biological effects of POP exposure at the sensory level in insects, offering valuable data for ecological risk assessment, sublethal exposure studies, sensory toxicology, and environmental monitoring beyond chemical quantifications. Next one, please. So with these equipments, the unit is very prolific in terms of coming out with scientific outputs. These are some of the recently published high impact publications and discoveries from the unit, where we try to understand mechanisms of resistance as the publication that was done in PNAS, how silica contributes to resistance against Tuta absoluta, and also how RAP and plant technology to manage potato cyst nematodes. So some of the recent publications that has come out from this group, pheromones from different from Pholameum, and also root exudates of invasive plants, how they can interact with malaria mosquito vectors and others. These are some of the publications that has come out in high impact publications. Let's move on to the next one, please. In terms of pesticide residue assessments, as I already indicated, most of our work are related to what we do. And in this case, we have tried to understand insecticide contaminants present in edible insects in Uganda. And we are also trying to see pesticide residues in honey and other bee products, and all those publications that are there. But we look forward to extend our collaboration and seek support in optimizing sampling and analysis protocols for the global monitoring platform, and also to support the initiative at the continent level. Because recently, as we engage with the national governments, we feel that there is a capacity gap in terms of analysis, which we can bridge. But I think we also need to have some strong collaboration both within Africa and also beyond to make this possible. Thank you. The next one, please. So in terms of accreditation status, we comply with the good laboratory practice guidelines and adhere to EU standards for pesticide quantification. And with the current instrumentation and skilled personnels, we feel we are well positioned to support implementation of UNEP global monitoring plan and WHO protocols for human biomonitoring, and USCP and EU standards for screening and quantification of POPs. But however, targeted benchmarking of our lab with other international laboratories and also capacity building will further enhance our readiness and compliance to support this initiative across the continent. Next one, please. Yeah. I think with that, I would like to acknowledge all our donors. These are major core and project donors of SAP, whom we normally acknowledge with our presentation. And I'd like to thank you for your patient hearing of my talk. Thank you.
Yes,
I'm
thank
happy
you,
to take any questions.
Dr. Yes, thank you, Dr. Subramanian, for this good overview. Yeah, like I said, I was last time in November impressed. I'm impressed again from your presentation. How many equipments you operate in Africa, where I have seen that there are often conditions with electricity shortcuts and so on. Yeah. One question. So, of course, you analyze the pesticides, pesticides. Have you established already some of the analysis of the industrial POPs in the laboratory?
Thanks for the question. I think this is where we are looking at extending our work and collaboration. We've not been looking into the industrial POPs, but I think with the instrumentation that is there and also the human resource that we have, this should be possible with good collaboration and training that we can get from your side. Yeah, thank you.
Yeah, for sure. Yeah, okay, super. Yeah, good. So we come to our next speaker. This is Professor Jana Klanova. She is director of RECETOX, which is the Stockholm Convention Regional Centre for Central and East Europe, located in Czech Republic in Brno. The center has long-term air monitoring experience in Africa and contributed much. So I'm quite interested in your talk, Jana. Over to you.
Thank you very much, Roland, and thank you also for inviting me to give this presentation. As I said, I will speak about the Stockholm Convention Regional Centre for Capacity Building, but I will briefly also touch upon the newly built research infrastructure on environmental impact assessment, IRENE. Next, please. So talking about the Stockholm Convention Regional Centre, I should say a few words about the RECETOX Center. Next slide. RECETOX Center is, can you please move the slide?
Still not in the presentation.
I think something happened. Okay. Is it moving at the moment?
It is only first slide I'm seeing.
Okay, just 1 second. Hanyu, could you please share your screen again?
Yes.
Apologies. And let's give it another try.
That's the first one. Next, please.
You do it by hand. You just click on the next by hand.
Because we see it on the left side of the screen.
Yeah. Yes.
So we are still on the first page now?
Yes.
Yeah, you are on the
We
first
see
page.
all the remaining slides on the left side, but you only share the
okay.
first.
Yes.
Try again. Sorry.
It's not showing up in the presentation mode. If you're in two screens, probably you can get down to one screen. So I'd be
Maybe if you go to the presentation mode.
Yes.
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 Okay.
Okay.
So the Recytox Center has been established already 40 years ago, and it was really to react to the environmental problems and chemical pollution. So these 4 pictures are showing the 40 years of development, while the first 10 years was really looking more into the exposure side and working also with the industries, identification of the sources, and developing the analytical capacities for exposure science. The next 10 years was much more looking into the hazard assessment and chemical risk assessment, building also toxicological capacities. Then third decade started our collaboration with the policymakers. We got engaged with the Stockholm Convention. We've been around since it was signed, organizing a lot of activities in support to building the Stockholm Convention tools. And then in the last 10 years, we invested a lot into development of environmental epidemiology and environmental health. Next one. Since 2000, we are the official European Center of Excellence for Environmental Exposure and Human Exposome Research in Europe. So we teamed up with the ETH in Zurich and UCL in London to build additional capacities for the chemical exposomics. And we are really interested in linking all 3 points of the triangle. It means the environment, the society, and what does the society do to the environment and the human health, and then the human health itself. For us, it is very important also to work at the local level. We established something we call a Living Lab, which is a platform for collaborative research, having our citizens involved in the research, and of course, working also with the policymakers. Next one. So as a research center, we not only do the science, but we also do a lot of education. We have several educational programs at the bachelor, master, and PhD level, but we also organize the summer school, international training events. We've been working closely with UNEP and conventions on organizing all kinds of the capacity building programs. But important element is also the application both to the private sector and the public sector. And as I said, working closely with the community. And this really brought us to the closer interaction with UNEP and Stockholm Convention, because we act as the Stockholm Convention Regional Centre for Capacity Building and Technology Transfer since the beginning, since 2008, when these centers were officially established. While we are officially the Center for Central and Eastern Europe, we provide a lot of support to Africa, Asia, South America, and other regions. And since 2003, we are also the official WHO collaborating center. Next. The reason why we can mobilize so much resources in support of policymaking and the regions of need is that part of the Recytox structure is so-called research infrastructure, which is officially included in the national roadmap of the large research infrastructures since 2012. What it means is that the Czech government is investing a lot of resources into building capacities that would provide the services to the researchers, but also support the policymaking. And we have 4 core facilities supporting research. So we are developing the monitoring networks. We have several in-house population cohorts. Those are grown-up birth cohort, fresh birth cohort, aging cohorts, national seroprevalence studies, and such. So we are also supported by the large biobank. We have accredited trace laboratories that can measure organic and inorganic chemicals in all the environmental matrices and the human tissues as well. And we are also building the information platforms. And all of this was also provided to support the Stockholm Convention. In the yellow map in the middle, you see with the blue dots all the countries and sampling sites that we operate to support the global monitoring plan of the Stockholm Convention. And the map in the left corner is taken from the information system that we've developed and operate in support to the collection of data for the global monitoring plan. Next one. Well, you already said that there is a big challenge in collecting the data from Africa. I would say that the biggest challenge is collecting the data in the long term in the harmonized way. We've been asked already in 2008 to set up the first air monitoring program in Africa using our passive sampling devices. We started working with 15 countries in the beginning. We provided the first African data about the air pollution for the first global monitoring report of the Stockholm Convention. But the trouble is it's very hard to keep the system running. Even though all the data would come to our laboratory, we analyze them, and we are paying for all the analysis, it's very hard to keep the local partners motivated. And one of the problems is that I don't think there is really the consistent policy from UNEP and Stockholm Convention how these monitoring programs will be supported. Because there was a lot of GEF and UNEP projects supporting building the capacities, analytical capacities, sampling capacities. But every time it is a little bit different. It's not really long-term. Those are short-term campaigns, every time being backed up by the different analytical capacities, which means that it's very hard to get a consistent picture and consistent data for analysis of the long-term trends. So in this map, you see the sampling sites that stayed with us for all those 15 years. So these are the data that we were able to collect for the first, second, and third global monitoring report. And they are good enough to do the assessment of the long-term trends of the atmospheric pollution in Africa. So if you look to the right at the picture, it is showing the long-term trends of different types of the pollutants. And you can see that for PCBs or DDTs, there is a clear declining trend, while for brominated flame retardants or PCDD, the dioxins and furanes, we don't really see much of the trend. And these are exactly the type of the data that we are looking for in order to assess the effectiveness of the international convention. Next, please. So I think it is very important to not only focus on the short-term project and the regional thing, but also be aware of the synergies and large programs that can support our effort in the countries that are low income or don't have enough capacities. And there should be one large European project mentioned here, which is the Partnership for Assessment of Risks from Chemicals, which is the large Horizon Europe project that was initiated 3 years ago, and it still has 4 years to go, and builds a lot of capacities, but also invests into harmonization of the data, mapping existing capacities in Europe for the hazard assessment, exposure assessment, building the models, but also building the capacities for analysis and interpretation of the data. Because we need to build not only capacities for monitoring, but also capacities for the data presentation and interpretation. But I said, next slide, that I will also speak about IRIN. IRIN is something different. It's the European Research Infrastructure. And this is the long-term concept developed in Europe already since 20 years. European has something called European Strategic Forum for Research Infrastructure, which is the abbreviation of ESFRI. And every few years, ESFRI publishes the roadmap, which is the list of the research priorities of Europe that require building the large-scale databases. So already in 2021, we helped to identify the need to build the European capacities for environmental and chemical risk assessment. This project is called IRENE, and you see the whole list of the countries that already joined the project. The beauty of it is that it is not just 3 or 5 years long project, but this is really the life cycle of such research infrastructures is 2 or 3 decades. It's a long-term effort where the member states are investing their national resources to develop the national capacities, while European Commission gives the coordination money. And these research infrastructures are not limited to Europe, but as you can see, we also have UK, US, Australia, and other countries. I should also mention that there is a big overlap of these efforts, not only with the PARC partnership, but also the International Network for Human Exposome, because currently there is an effort both from Europe and US to build the international network of the facilities and research institutes that want to study impact of the environmental factors on human health. And they are reaching out to the regions like Africa and South America, Asia, to really build the international community to make sure that there is enough capacities, enough data and information from all regions, also those that have very different, not only environmental, but socioeconomic conditions. So I would really encourage our African partners and also partners from other parts of the world, because I saw a lot of participants from other continents here on the list, to reach out and learn more about IRENE and the option of joining the consortium, learning more, benefit from those capacities, from the training programs and such. But I would also suggest that IRENE should be part of the large capacity building programs, including, the global monitoring programs, because I think there is a big need in harmonization, not only of data, but our efforts and the new monitoring programs to make sure that every dollar invested really brings back additional resources and capacities in the regions. Next slide. I think I can just finish with the greetings in Brno, because part of our support to UNEP are also our training programs. Every year since 2005, we are organizing international summer schools. Sometimes we co-organize it with the Secretariat on UNEP. We are having the visitors and trainees from all the regions of the world. This is happening right now. So this week is the week of our International Summer School. We have a lot of people who were identified through our collaboration and the activities of the regional center and our National Center for Toxic Compounds. So please, you can also go to the RECETOX webpage to learn more about these capacity building programs and the summer schools, and look for the future opportunities. Thank you.
Yeah, thank you very much, Jana. Yeah, I absolutely agree that it is important to have this long-term data, as you showed. And I'm sorry to hear that, let's say, several of the countries have skipped out. I would say that normally UNEP is, of course, has also the aim of this long-term monitoring. And you see that this is, I think, already the GMP, the fourth GMP program. And normally these programs are then, let's say, 5 or 7 years. I think another thing is not possible. Here, of course, one challenge is, let's say, in governments, people are changing, and sometimes you have a ministry which is very much interested in air monitoring. And of course, if this then changes, there are then challenges, let's say, to get the next person motivated. But I agree that here maybe the UN need to support the collaborators more, that such monitorings are better continued. For the IRENE, what do you think could be possible directly with Africa? You mentioned that there is some capacity building, some information sharing, because I mean, yes, Australia probably they have their own national program, so you can link it. But what kind of cooperation you could imagine might be possible?
We are, the research infrastructures are based on the national nodes. So if we have, at least in some African countries, the interest or research institution or someone who would like to set up the national node, we would be happy to invite them to the meeting. It's even the European programs that are paying for research infrastructures are open to other regions. There are also the calls for research infrastructures are specific calls of the horizon. Very often they are open also to the developing countries. So it's one additional mechanism how we can bring some money to the region for the capacity building. And just, the exposure to the network of the universities and research institutions that is working in this area, and they can provide the guidance and data and databases and laboratory capacities is a big benefit. And as I said, those capacities are built by the national investments. So we can be partner for the governments who decide to build such capacities. And we don't need to have them in every country. Because if you set up the monitoring program in Africa, the samples can be sent to one of the network laboratories. And this is something that was developed in PARC, that we have the network, the network of the laboratories, including the information of what they analyze and whether they have the accreditation or certification. So we can assure that the data that will be generated are good quality and comparative data. And there are also the projects that are paying for the services. So sometimes within these projects, we can provide the free services. And this is what we actually did for UNEP. All those data from the long-term monitoring in Africa were paid basically by the infrastructural money. So if we better coordinate and develop the long-term program, we can bring different financial resources together to really support getting better data, but also building better capacities in Africa.
Yeah, no, I think very interesting for governments, but also institutions like ICP, for example. Yeah.
Yeah.
So maybe I don't know if you have let's say compiled a note and share it with Chitendra and Haosong, that they can feed it in somehow in the GMP. Maybe that could be really beneficial. This is now just under the development, the GMP. And not running. Yeah, so maybe it could be a good time to discuss with Chitendra and Haosong what could be possible. Yeah.
Yeah, happy if she reaches out. We can discuss it further. But our experience is that many of our countries dropped out from the program because they were just confused. Because they started working with us in 2008. They were very happy to contribute and run the on-site monitoring programs. But then they were reached out by many different people with the new projects, with new responsibilities. Then they were supposed to expose some short-term samplers. In the end, they were really confused about which samplers go to which program. And then once the short-term program ended, they stopped investing into the long-term programs. And it's really a pity. We really lost many of our sites just because there were overlapping GEF projects.
Now, this, of course, should not happen. Yeah. And therefore, short communication lines are very important. Yeah. Thanks, Jana. Yeah.
Thank you very much.
So, you're welcome. Yes, so we come to our next speaker. It's Dr. Givao Bondi. He was for many years a senior analytical chemist in the regional center in Kuwait. He was then also head of EPA in Sierra Leone and currently is member of the POP Reviewing Committee and the Stockholm Convention Effectiveness Evaluation Group. Dr. Bondi, over to you.
Thank you. Can you hear me, Roland?
Yes, we can
Right.
hear
Okay.
you very
Thank
well.
you. Thank you very much. Thank you. I want to start by thanking the organizers and you, Roland, in particular, for inviting me to share my views on the research needs and opportunities that exist in Africa. Like you said, I worked in Kuwait for many years at the Stockholm Convention Regional Centre for West Asia. And I do serve on the POPRO committee currently and the Effectiveness Evaluation Committee. And having served on those two committees, it actually informs me about the gulf that actually exists between the global north and us in the global south, and especially us in Africa in particular, on these issues that we're discussing today. The problems I have highlighted in the slides are really not unique, and I'm going to focus on the topic, which is talking about the priorities and the research needs. They're not unique, we all know them, but I will highlight them anyway to see if that can spark some, discussion later on in the conversation. We all know that the Stockholm Convention was enacted over 20 years now, and most African countries have developed their national implementation plans. In Sierra Leone, we developed the national implementation plan in 2007, and it was likely updated in 2018, from what I was told by the Stockholm Convention focal point here in Sierra Leone. But there are problems. We all know that in Sierra Leone and probably in most other African countries, there are no formal management, protocols for POPs. Capacity of contaminated sites is either limited in Sierra Leone particularly, and probably in most other countries in Africa, or they're not existent at all. There's very low public awareness of the dangers that are posed by chemicals in general, and POPs in particular, in Sierra Leone, but I'm sure that extends to Africa as well. And that even extends to people who work on chemicals. Legislation exists in Sierra Leone, but the enforcement regime is very weak. So these are some of the issues. Next slide, please. So in Sierra Leone, and probably in a few other African countries, there's not much information at all on past chemical usage. Although with the development of the inventories for the implementation plans, that's changing a bit. We all know that the expertise on monitoring POPs is still in its infancy. There are quite a lot of people who've done POPs research in the West, come back and probably fallen by the wayside. But I was happy to learn that we now have a center of excellence in Kenya. So hopefully that might change things going forward. So because of these challenges, we don't really have very reliable environmental data on the levels of most of these POPs. And we continue adding to the list of POPs that we're monitoring. Like I said, being part of the POPROC, current POPROC, we are continuously listing chemicals, and we lack the capacity to even monitor and report on the ones that we already have listed in the past. But we still keep adding, and that keeps adding a lot more challenges, more pressure on the continent and probably the people who actually support the continent in reporting, in their reporting obligations. So, like I said, the only consistent data set is from the GMP activities that started a few years ago, and a few other efforts like the MONE network and the GAPS network. But besides that, most studies that have been carried out in Africa are probably opportunistic. Like somebody goes to do a PhD abroad, comes collect samples, or does a project in Africa, reports. Once that's finished, that's it. The project ends. So those are key challenges that we are facing on the continent. Yeah, next slide. Can I have the next slide? Yeah, so one of the needs, you know, like I said, we all know, is to see if we can initiate, well, we've initiated some of these studies, but to have that expanded across the continent. Because like the GCMP project that's been going on, and with the new approved project, it's only covering like 8 countries. Although when we are designing that project, when that project was being designed, some of us who were on, you know, who attended some of those meetings advocated for, you know, a wider coverage of the continent, and that was not agreed to. You know, for funding reasons, funding restrictions, and maybe other logistic problems. But you know, the continent is poorly covered in terms of spatial coverage. So although we are generating information, but there's, you know, there's a lot of gaps across the continent. If you look at the map itself, which somebody put up earlier, you can see that in the middle of the continent itself, there's no coverage. So that's something that will be a necessity, to have baseline information in these countries or across the continent. Maybe focus a bit on dump sites, because that's where in Africa, most landfill sites are not engineered landfill sites, so they are really dump sites. That leads to a lot of, you know, release of quite a lot of intentional and unintentional POPs. So there'll be clearly a need to do, you know, some look at regional and seasonal variations in POP concentration. Next slide. Yeah. So like I said, you know, there's very little that has been done on exposure assessments. You know, food, indoor air, human samples, you know, both in Sierra Leone specifically. So these are all research needs. Like I said, I'm going to focus on the topic, which is the needs and the opportunities that exist. So that with these studies, we'll be able to assess the links between exposure and the disease burden. Like I said earlier, these you know, the convention is 20 years old. You know, we've developed national implementation plans like in Sierra Leone, but the stockpile still exists. For example, in Sierra Leone, I know a few other countries across the continent have gotten rid of some of their stockpiles, but like PCBs, the elimination date is 2025, and we still have stockpiles of PCB oil, you know, across Sierra Leone, and I'm sure across a few other countries in Africa. So I don't know whether the 2025 deadline, well, it's already 2025 or 2020, yeah, the deadline is already on us, and I don't think that deadline is going to be met. Next slide. There will be a need, in my view, to investigate obsolete pesticides that are stockpiled, you know, and how that leads to food contamination. In Sierra Leone, you know, most of the food we eat is not being monitored at all. Nobody knows the quality of the food we eat in relation to POPs. So we don't even have any idea, and I'm sure that's across the continent as well, about human exposure. Next slide. Unintentional POPs, the same story. Sierra Leone, you know, a few years ago, I when I was in Kuwait, came to Sierra Leone, and I asked a few colleagues in across the continent to collect samples from dump sites and landfill sites across Africa. I came to Sierra Leone, did a few sampling as well, and we did some analysis for dioxins, furans, and pesticides. Some of that results was presented at the dioxin meeting in Japan, which showed quite high levels of dioxins at dump sites and landfill sites that are not engineered. And I'm sure this problem is not a Sierra Leone problem, it's an Africa-wide problem. So that clearly presents opportunities for research going forward. Next slide. Of course, we've been talking about this forever, capacity building. So I'll re-echo that. Now we have some laboratories across Africa that carry out this analysis. And during the last GCMP planning sessions, UNEP has now agreed that these laboratories will be given the opportunity to show if they can meet the quality requirement to do this analysis on the continent. That will help build institutional capacity and strengthen the capacity across the continent for POPs analysis, and hopefully that will spur on research on POPs on the continent. Because before now, most of these samples have been carried to laboratories abroad. I heard Yana talking about losing some of these sites because people sometimes lose interest. If they're only used as sample collectors, they might lose interest in, see what's in it for them. So maybe that might be one of the reasons why some of the sites that Yana was talking about, were discontinued. But now that they have been allowed to do this analysis on the continent, maybe that, just a maybe, that probably might, change people's view on how we approach some of these opportunities that show themselves. One of the things that I think PopRock was asked to do, which I didn't go to this COP, but is to help developing countries identify POPs in articles that are in use, stockpiles, and waste. Because most of these things that are shipped to Africa contain POPs, but neither custom officers nor end users have any idea of identifying whether these articles or these stockpiles or even waste that are generated contain POPs. So there was a labeling requirement which the Stockholm Convention, which the African group was pushing for, that will help in POPs management, in proper management of POP, articles and POP waste when they become waste. So hopefully that went to the Conference of the Parties and it may have been adopted. Because if there's a way of our custom officers being able to identify articles that are coming to the country that contain the chemicals that we've listed, then it will help with management. Although most African countries don't have the capacity to properly manage these waste effectively, but at least it provides that level of information wherein regulatory agencies can probably supervise the disposal, either on the take-back program or whatever. So proper waste management programs, can help reduce the release of UPOPs and other POP chemicals in the environment. Next slide. So to conclude, and to probably share, open up this for later discussions, we in Sierra Leone, we lack baseline information and exposure, data. We don't know the risks that people are exposed to, whether the food they eat or the water they drink is free of POPs. Well, not free of POPs, but whether the POP levels are within acceptable limits or not. There's no indication because we don't have the capacity to measure. We don't have and I'm sure it is not a Sierra Leone problem. It probably might be an Africa-wide problem in most countries. Regional cooperation, now that we have some laboratories across the continent that can analyze these chemicals. So maybe data sharing, regional cooperation might help improve the situation on the continent. Of course, capacity building, but we cannot keep building capacity all the time. I know for a fact that there are so many research scientists across the continent who are highly trained, analytical chemists, but lack the capacity. But the situation might be improving with the current, availability of a regional center that is like a center of excellence in Kenya and a few other laboratories in South Africa and Senegal. But I'll probably also throw this in the works that if we want to look at time trends, I know when we went to Lima, that was something I highlighted, but it was not accepted. There are other natural archives that can give a snapshot in time trends of POPs, especially like hydrophobic POPs.
Okay. Yeah, so it seems that we lost Dr. Bondi, yeah, but he has just more or less finished. Yes, I mean, what he said, more laboratory, more analysis in Africa, we have also considered here in our roundtable, and therefore the next speaker I would like to invite is Saidi Motladile. He is principal chemist at the National Environmental Laboratory in Botswana, and recently just finished their national implementation plan together. And now they have the adventure to develop a dioxin laboratory. Over to you, Saidi.
Thank you, Dr. Weber. And I would like to take this opportunity to also thank GGKP for the opportunity to be in this meeting. I will look into my presentation will be focusing on our research needs and what we've also put up in Botswana with assistance from our partners. Next slide, please. Right. As is a requirement from the convention, Botswana remains committed to the management of POPs, and as such, we submitted our first national implementation plan in 2011, and we've just recently completed our second one and submitted it this past April. And then there's also need from the NEP that we submitted. It showed that there's need for research because some of the data that we got, it is the data that was based on assessment tools like for dioxins and furan, where we didn't have national factors, and therefore we really need to conduct research. And for us to really manage POPs, we believe at the center of POPs management is adequate, research and available data. Next slide, please. Our research needs and priorities stems from the fact that there's been recently listed POPs, and therefore there's going to be need to also, have data on these, in addition to the ones that we've also identified in our country. We also need to have baseline studies for us to effectively evaluate this POPs chemicals. And of course, the data will also be needed for us to develop alternatives for POPs, especially in agriculture, and also manage our waste. We also need to also do risk assessments risk assessment looking at the effect of POPs, especially to the marginalized members of our communities, to the assessment which is gender balanced. We also need to do interdisciplinary research that is linking environmental science, toxicology, and policy. We are really lacking in these disciplines. Next slide. So the National Environmental Laboratory, which is housed under the Ministry of Environment, the Department of Environmental Protection, it's a regulatory lab that is based in Gaborone. And as a regulatory lab, we have to do more environmental monitoring. And the lab has for some time been doing PCB analysis. And with the assistance from UNIDO, we're able to get an extractor, an automated extracting machine for dioxins and furans. And we are in the process of now looking into dioxin analysis. But for starters, for this year, we'll be looking at dioxins around one of our problem landfills in the next to the city. It's a well-engineered landfill, but it's running and maintenance. It's lacking, and therefore this landfill is constantly burning, and therefore we will be looking into dioxin levels in that village and around that landfill. And then this program, which was for capacitating labs in Africa, also assisted Tanzania and Eswatini in dioxin and furan analysis. So we are able to be capacitated both in terms of the analytical capability, in terms of the equipment, in terms of the reagents that we needed, the whole analysis process until we get the results for dioxins and furans. And then our university, especially University of Botswana, they do have equipment to be able to do POPs analysis. I think all we need is to expand in terms of the capacity for us to be able to generate more data. Next slide. In terms of regional and international technical support, all thanks goes to UNIDO, but we still need more technical support. And I think from Professor Yona, she provided an interesting platform where I believe once capacity is available up and running in our lab, we would be more than interested or more than willing to join one of the nodes and also be able to analyze and provide data for the region. Also, we would need our African regional centers, especially the Africa Institute, to facilitate capacity building and analytical training for POPs analysis. And of course, SADC initiatives, regional collaborations, especially with countries which have advanced analysis like South Africa, so that we can probably generate data at the same level of quality. Next slide. So what we really need, as I indicated in my first slide, is joint research between our labs in the country, at the academia, and also bilateral exchanges, benchmarking. I was really interested in what Professor Yona presented as a forum for bilateral exchanges for laboratory so that we can have capacity for our analysts to be able to undertake this work. Next slide. So with regards to science and policy, there is need for establishment of national science policy interface for chemicals and waste. As it stands right now, there is limited, legislative and policy framework, especially in our country, with regards to chemicals management. So that is why we in the country don't have a base law for management of POPs chemicals, but we do have other legislative framework which deals with the waste, but are not specific to POPs chemicals. We also need to do a lot in terms of embedding research into policy processes. So in terms of research, I think our research capability is low, and it is made low because of limited technical and financial assistance. Next slide. So in conclusion, for Botswana, and I believe the same for Africa, there is need to strengthen research capacity and also integrating science into policy. Bringing in the political will into POPs management and research. And also there is need for collaboration between labs so that capacity can be shared or extended within the region. And we also need to leverage national strength and regional partnership to achieve effective POPs management. With that, I would like to say thank you. Next slide. Thank you.
Yes, thank you very much, Saidi. Yeah, and good luck with your establishment of dioxin laboratory. If I'm right, there will be also an establishment attempt in Tanzania and Eswatini. So I think good cooperation and capacity building will be needed there. Before I come to the next presenter, I would like to highlight that there is in the chat Mentimeter, which are asking about the research needs in your country. So please go to the chat, click to the Menti, and type in your research needs, which we will compile together. Also, there is the question about the recording. Yes, this webinar, this roundtable will be recorded, and the people which are attended will get it then as a link. Jana, you raised your hand.
No, I'm sorry, I didn't.
Okay, then we can come to our next speaker. That's Professor Burhan Majoub from the National Research Institute in Tunisia. The institute has the plan or the idea to develop PFAS analysis in the laboratory. And over to you, Burhan. What else you want to share with us?
Okay, thank you very much. Thank you, Roland. Thank you, and hello everyone. And thank you also for the opportunity that you gave me to speak today. So I was invited to share some insights from our national experience in Tunisia, which also can reflect many of the challenges we face across Africa and North Africa specifically, but according to what I have already listened to my colleagues in the previous presentations, we have the same main challenges. Anyway, we'll try to see how we might move forward together. Next slide, please. I don't have the full scale, the full screen scale. It's okay, no problem. The most important is that everybody sees the the slides accordingly.
Yeah, we see it. Yes.
Okay, so let's start by the regional context. Across North Africa, we are still dealing with the legacy of older the mainly banned POPs, pesticides, etc., mainly, that are still present in our soils, sediments, and sometimes even in food. So in our region, POPs are also of particular concern because of the impact of urbanization and industrialization, especially also in the coastal areas. Things like also e-waste, open burning, uncontrolled landfills, etc., etc. But also climate vulnerability, because as you know, in our region we have quite high aridity and heat, which can also influence the POP's mobility. And also the food chain risk, of course, eventually, especially in fish, in our very dense coastal communities, but also dairy and meat. At the same time, there is a pressure to improve recycling and reuse, especially water, with our major water scarcity issues. But unfortunately, these recycling and reuse strategies often are done without adequate chemical controls. So monitoring capacity remains weak, and most countries, including Tunisia, are still catching up in terms of labs, equipment, and training staff. I will talk about this later. That said, political will is growing. All North African countries have ratified the Stockholm Convention and submitted their NIPs, with some updates, of course, through the UNEP-led processes. Next slide, please. So just 2 words in Tunisia's effort on POPs. In Tunisia, we have made some solid progress on legacy. I will not speak about everything because I just have a few minutes to present. So just mainly progress that on POPs, legacy POPs like DDT, PCBs, HCB. Anyway, Tunisia has taken relatively good steps through the Stockholm Convention programs. For instance, nearly 1,800 tons of banned pesticides have been destroyed, and over 1,200 tons of PCB containing equipment were safely disposed, and with around also 400 tons still pending. Also around 1.2 million liters of PFOS containing firefighting foams are being phased out. We have 2 national inventories were completed, including PFOS inventory, draft regulations, etc. As you know, Tunisia also is actively participating in the global POPs monitoring programs like the other countries. And also recent air samplings, I've seen that some recent air samplings has been made, and they showed quite high PCB levels, amounts, maybe among the highest in Africa, which confirm the need for more sustained monitoring. Next slide, please. So now, when we look at emerging POPs like PFAS, brominated flame retardants, and SCCPs, and now, as you heard about, also medium chain CPs, we are now in more uncertain territories. For example, we recently found PFAS in seafood in Tunisia for the first time. It's not a very high amount, but anyway, it's a clear warning sign. We've also analyzed sediments and found both legacy and newer flame retardants. We know PFOS was used in sectors like aviation and electronics, but we still haven't been able to quantify that properly. In general, there is no routine monitoring, and specifically SCCPs are virtually unstudied across North Africa, and industrial data also is hard to access, and the informal waste sector isn't being tracked at all. Anyway, these issues also must be discussed. Next slide, please. For the laboratory infrastructure, as has been said from some of my colleagues previously, except some impressive analysis center and research centers that I've seen, I think then one of the major challenges is analytical capacity. Instruments like LC-MS-MS and GC-HRMS, which are essential for PFAS and SCCP analysis, are either not available or extremely limited. Or when they are available, we don't have the methodology and the technique to make the analysis. For example, in our institute, we have these equipments, LC-MS-MS, especially mass spectroscopy equipments and other. We are certified in making pesticides analysis. We have already made the dioxin-like analysis, PCBs, and others, but we still are not able to make this PFAS and other also POPs analysis. So that's why we are willing to try to be step by step a national reference lab for these substances. And as that it has been also said previously, most monitoring is linked to short-term projects. So even when there is interest, we lack the ability to sustain long-term tracking. So there is this is a major structural gap that limits everything from detection to policy. Next slide, please. Another important point that I wanted to point out is that, okay, I said that Tunisia is making progress aligning POPs with broader sustainability strategies, especially in waste management, but there are some crucial links that are missing. For example, recycled plastics are not screened for POPs, specifically for flame retardants. The waste water reuse, that it's becoming more and more a national strategy plan in our North African countries, specifically in Tunisia, because we lack of water. So these wastewater, treated wastewater reuse doesn't monitor PFAS or other POPs, or in general some emerging pollutants. So this risks reintroducing, like if we reintroduce the POPs into the products and the systems. So we need to make sure that circular economy strategies don't end up reintroducing pollutants into recycled materials, and then not making circular economy become a circular toxicity. Next slide, please. So the key research gaps that many of them has already been mentioned by my colleagues, but we can first mention that we lack solid environmental monitoring and harmonized data, especially at the regional level. We also need to look at how these pollutants behave in our local ecosystems, especially with our arid climate and water scarcity. There are almost no long-term studies on health effects and population exposure. Toxicology and risk assessment capacities are very limited across the region. We also need more research into local sources and pathways of POPs, including the informal waste burning and agriculture. And also, finally, the co-exposure to multiple pollutants and studies on new POPs are largely missing. Last but not least, research on safer local alternatives is missing, rare, especially those aligned with green and sustainable chemistry. Next, please. So my recommendation, quick sum of the recommendation could be these 6 recommendations: equip and train national labs, of course, prioritizing MS capacity, create regional hubs for POPs monitoring analysis, include PFAS SCCPs in national updated NIPs and action plans, mainstream POPs into circular economy and reuse policies, standardize monitoring with UNEP and Stockholm tools, engage universities and research centers to boost the academic research and awareness. Next, please. So my final message could be, we know POPs are present. We know tools exist to detect them, but it's time to move from sporadic studies and fill the gaps with more structured, data-driven, science-based actions, and maybe with the support of global partners like UNEP, GEF, GGKP, and all other global partners that are represented today. Africa and the region can close these gaps, try to prevent recontamination, and better protect people and ecosystems. Thank you very much.
Yeah, thank you very much, Professor Machoub. I absolutely agree with you on the monitoring needs for circular economy. Yeah, especially what you highlighted, recycling of wastewater and the PFAS. Therefore, good that you strive to develop PFAS. I mean, we had recently this good workshop in Tunisia, right? So you had the first link to Spanish PFAS laboratory, which is also interested to support you. So I am quite confident that, let's say, in a year time, that you might have a PFAS capacity in your laboratory and that you can help the region also to generate data. Coming to the next presenter, it's Dr. Gilbert Kouepouo from Cameroon. He is also a member of the International Pollutant Elimination Network in Africa. And over to you.
Thank you, dear Roland. Yes,
Yeah,
I am
yes,
online.
Yes, we can
Can
hear
you get me? Yes. Thank you, dear Laurent, and then GGKP for having me here to share my perspective on the on the need and opportunity in implementing the national implementation plan of the Stockholm Convention in Africa. So I have more than 15-year experience working on POP issue with implementation of the Stockholm Convention in Cameroon and several other African countries. So I'm coming from the perspective of, as you indicate, a non-governmental research group that is assisting country in implementing the Stockholm Convention in Africa. On this slide, we are familiar with this one, so I will focus my intervention on inventory challenges and opportunity because it is very important to comply to Article 7 of the Stockholm Convention. This graphic is, you can see, indicate a kind of challenges that or resource versus complexity that we need really to overcome some challenges in make sure that we make a good inventory of POP in the country, because good inventories is a basis to inform other decision and then fulfill with the obligation under the Stockholm Convention. Bear with me, and then we can see that we have at least 3 tiers. That is initial inventory, we have basic inventory, and we have in-depth inventory. And most of the time for the African country, we are struggling with the first one, but the lacking is the in-depth inventory, which is necessary a little bit if we need to address risks that are associated with the exposure to POP in country. Next slide, please. So on this slide, I briefly show that the challenge that we have summarized. need in terms of resource, in capacity and competence and equipment and knowledge that prevent the comprehensive assessment of the status of the POP in country. All other speakers highlight this issue. I will not go in detail. So next slide, please. Yes, on this slide also, although we recognize that there are challenges on tier 1, but most of the challenges, as I indicate, for the inventory of POP in Africa on tier 2 basic inventory and on the in-depth inventory. So, and then in terms of maybe how much POP do we have in an import product or maybe article? Let's take the case of maybe a POP PDD in article and product for the when you are doing the inventory is something that we don't know, and how to fill that gap we really is something like a challenge. We need to go down to the maybe in-depth inventory, and in-depth inventory means that we need a kind of analytical method that is screening using XRF, for instance, that most of our country we don't have it even in the NGO space. And then we need to do some measurement, as many distinguished scientists indicate earlier, do the mass spectrometry or any kind of other equipment that we need in place. We need resources for more detailed maybe inspection of sites. When we have challenge, we need to verify to have data, accurate data, and make a clear assumption from what we try to assess. And then we need a kind of compilation of material and substance flow analysis to complement what we have as challenge in the basic inventory. Next slide, please. Yes, on this slide, it is indicating that we really need lack of readily available information and statistics on POP across sector and agency in the country, because even if you limit yourself to the tier 1 or tier 2, there are no basic data that somebody or maybe those in charge of inventory can really have through the country to start from where. So we need to create such kind of enabling environment and available statistic, and through all the register that we can have from importation or from custom data, so that we can have a kind of readily available information and statistic on POP that we are using, underscoring the fact that we are not manufacturing all these chemical. We are net importer, so we need to develop capacity on that area. So, and then we also need to push for implementation of a GS, for instance, that will bring more transparency through the labeling of the chemical that we bring in the country. So these are the challenges that we need to have, and country can take steps to really implement the GSS, so that we have more information on POP that are entering our continent through article and product. So we need to develop a readiness for POP inventory, and then it is something that we should start from there and fix it. And then the government can try to reach out, or maybe the focal point can try to reach out to all the ministerial sector to maybe train them how to keep a kind of sector inventory that are relevant to the implementation of the Stockholm Convention in country. So once again, I'm focusing only on inventory aspect of the implementation of NEP. Next slide, please. Yes, now we need to look at some opportunity that are available out there through the NEP implementation in Africa, and most of the big opportunity is to create an enabling context for maybe in-depth inventory. So, and then to further involve the university and the research institution in national implementation of the Stockholm Convention on POP and other MEA. And then we have at least 3 things to do if the government really want to implement the Stockholm Convention is massive investment in analytical method that may include portable XRF fluorescence that can use to screen chemical in product and article. We need laboratory facility, and I was very happy to hear from colleagues from Kenya, Botswana, and Tunisia about that they are doing something around that one, but they should be sustainable and trying to get us a kind of accreditation to make them generating data that are comparable with other data generated in other regions. So we need a kind of facility to have quantitative measurement because they are very important in try to address the issue from the policy perspective. We need to train and retain skillful and competent staff in country to implement the Stockholm Convention, including research, monitoring, analysis, and doing all these things. And also we need to improve the energy and water supply system because most of the laboratories are not well functioning because some external factor like energy sustainability or supply sustainability and water supplied in the facility is not always guaranteed. So it is a kind of holistic approach that we need in this one, and this the implementation of the Stockholm Convention give the opportunity to move things across and all the developmental aspect of the life that we can consider. The next important point is developing the competency and the skill on material and substance flow analysis, including through international cooperation, because if I take the case of my country, this is not a subject that is taught already in the university, but we need to bring it up because it will be helping our country to really advance in terms of implementing the Stockholm Convention through information data monitoring and through getting the accurate information to report to the implementation of the Stockholm Convention. We, as many as already indicate, POP monitoring in all the media is very important, including maybe on the food chain contamination. And then that is something that is really need, and it is an opportunity that we need to go in and for in order to advance the implementation of the Stockholm Convention in our region. Next slide, please. Yes, and in terms of this one, as I said, we are mostly non-governmental organization, research organization and institute try to assist African government to implement their obligation under Article 7 of the Stockholm Convention, and we try to identify a kind of hotspot or maybe the source of UPOP in the continent, because this is when you look at the inventory, this is the large source of POP emission and release on the most of the NEP report. So we try to work around the small medical waste incinerator in Kenya, Gabon, and in Cameroon to try to see whether this can be significant in terms of exposing population or and other ecosystem around on POP that can be released during the operation. Next slide, please. And then on this slide, you show the result of the UPOP. That's mainly dioxin, furan, and PCB-like POP from egg, in egg from chicken that eating around the hotspot. Then this hotspot named on the table here. And then you see that in location, we have 3 locations in Cameroon, and then 4 locations in Ghana, 3 locations in Gabon. And you see that the last row on the bottom is the result of all the UPOP in terms of pictogram toxic equivalent fat. And you see that most of these egg have concentration of dioxin total above the EU standard limit, that is 5 toxic picogram toxic equivalent per fat. So sometimes it go up to 700 times, like on Aboboshi side, west side in Ghana. So this is a kind of data that we need, as Roland indicated, to point out that we make the invisible visible through data generation, and we are assisting it. Next slide, please. And also we try to analyze POP in plastic product in cooperation with IPEN and NECA, and we collect a sample from 7 countries, including Tunisia here, and then and we try to analyze them for POP PDDE and HBCD. And then next slide, you can see the result. Yes, most of samples for most of the country are largely above the low pop content level that indicate below. That is 5 microgram per kilogram for some of PBDE. This is the value that is supported by the African region. Let's be mindful that during the last COP, the decision was made on the low pop content for the PBDE, and there are 3 values that are now accepted globally. We have 50 ppm or 5 or 100 ppm or 5 or 500 ppm or 1000 ppm. So these are the value, but the Africa is supporting and uploading the lowest value, that is 5 ppm for the sum of PBDE. And you see that all these products that we see, when they will become waste, really a kind of pop waste that need to be generated, that need to be managed according to the technical guideline or the provision of the Basel Convention. Some of the time we don't have the facility to do that, though, so we need to know all this and try to see how we will manage all the waste after this product. And for the HBCD, we see that the low content value is 100 microgram per kilogram, and you can see on the graph from data from Cameroon, Ethiopia, Gabon, that we are above all this data or this value in terms of sum. So we are having a lot of problem through article and product, and we need really we have opportunity to do something to try to prevent this, to create more exposure that will bring high risk for population in our region. Next slide, please. So these are the same value for the data from Morocco, Tunisia, and Tanzania, and the trend is the same. Most of the product that we are using contain a lot of pop, and sometimes telling that this plastic maybe a recycling from maybe e-waste one, because most of this plastic are black material, and then it is suspect that they are being recycled from electronic plastic that where this pop have been using to prevent them for flammability. So we need to, these are the kind of information that we need for maybe to advance our inventory and really refine the data of the inventory, and then try to see more broader about the source of the pop that we are doing, and even going beyond the information that we have in the pop inventory guideline. Next slide, please. Yes, that was my last slide, and I hope it will be helpful for us, and I'm ready to answer any question. So we need to help a country have more monitoring data like what we present, because this is very helpful to identify contaminated site and hotspot and try to develop policy to address them and comply with the provision of the Stockholm Convention on POP.
Yes, thank you, Dr. Kuopio, for your good insight. Yes, and I completely support these regional studies, samples from different countries, and analyzing in laboratories. I have seen the question or comment from Madagascar that they would be interested in analysis of dioxins in samples. So I hope that SAIDI from Botswana, when they established their laboratories, that they will also do some regional studies. We come to our next presenter, that's Professor Jonathan Okonkwo from Tshwane University, South Africa. He developed over the years pop analysis capacity in his laboratory and will inform us how he did it. Yeah, so Jonathan, over to you.
Thank you, Roland. And thanks for inviting me to share what we have been doing in South Africa with regards to POPs. Next slide, please. Yeah, my interest in POPs analysis developed when during my master's program at Brunel University in the UK. And the course is just, amongst other things, involved hands-on experiments to actually determine the levels of these quite a number of POPs and pesticides using GC, and so on and so forth. And after that, the focus was based on developing new methods to measure organic and inorganic contaminants in various environmental media. And when I joined the University of Swaziland now, the Eswatini, my interest developed in terms of concentrating on monitoring DDT, based on the fact that the eastern part of Swaziland is very high in malaria incidence. And then we did, there was a breakthrough for me in terms of working on DDT in human breast milk. And soon after that, when I joined in Tshwane University of Technology based in Pretoria, we also did embark on looking at POPs in human breast milk. This was a joint research between us at TUT and the Uppsala, the Swedish Food and Drugs Administration in Uppsala. And we were able to not only just the DDT and metabolites, but also other POPs like the PBDs and so on. So there was a long, sort of a broad screening of POPs within the human breast milk sample. And since then, we've gone into various other aspects of Stockholm Convention listed POPs. And I'll share with you some of the things that we have looked at recently. Next slide, please. These are the established POPs and other chemicals of concern that we have looked at. As I mentioned earlier on, we've done quite a bit on DDT, particularly in human breast milk. PBDs, we also picked that up in human breast milk, but we've done that quite a lot in surface water, indoor dust, sediments, and as well as landfill site leachates, because we feel that quite a number of the wastes that may have these PBDs in them, at the end of their usefulness, they are dumped into the landfill sites. From there, they can leach out into the to form a cocktail of leachates. And we have also looked at OPFRs, developing authentic solvents for the extraction, and so on, and short-chain chlorinated paraffins. I must thank Roland here that he actually drew our attention in terms of that this was going to be more or less the new kid on the block with respect to being listed on Stockholm Convention. And I've got a PhD student that just completed this, a PhD based on this. And the same applies to PCN. And PFAS, we've looked at it and we're still working on it at the moment. We've looked at it. There was actually a national monitoring program for to look at various PFASs in water resources around the 9 provinces in South Africa. And we just completed, it was a 3-year project. And we just completed that But we are still have some students that are actually working on PFAS, HBCDs, and the UV328, dichlorane, and so on and so forth. These actually we looked at. Also, we completed a project for the Basel Convention Center, looking at, I think the project termed African plastics. We looked at a range of starting from PBDs and the PCNs and the PFAS, HBCDs, UV328 in plastic samples collected from 5 African countries. This was, I think, we completed it last year, or thereabout, October. It was a less than 6 months a project that we did for Basel Convention. And also we are looking at the alkyl phenols and the other POP related chemicals that we have students that are doing their either master's or PhD projects that embarking on. I must say that our lab is purely a research lab, and fortunately we're quite equipped with the very advanced, in some cases, and less advanced equipment that we can use for POPs analysis. And these are used, as I said, our lab is just for training, research oriented at master's and the PhD levels. Next, please. And of course,
you're muted. Jonathan, you need to unmute.
yes, okay.
Yes.
Sorry about that.
Okay, good.
Yes. So in terms of the quality assurance, with the methodologies that we actually incorporate into these analysis, we have quality assurance and quality control measures, and we have blanks and certified reference material recovery using surrogated standards, and these are just a standard operating procedures with respect to analytical quantification of any contaminant in any environmental sample. Next, please. In terms of progress, we've made quite a number of progress with respect to POPs development. And as I said, our lab is purely research oriented. And we're talking about training students that are engaged in master's, MSc, and PhD programs. And we've had quite a number of African countries, students from various African countries, Ethiopia, Ghana, Kenya, Nigeria, of course, South Africa, Tanzania, and Zimbabwe. One of the challenges is in terms of retaining a number of these students, because you sort of have a tendency for brain drain. Quite a number of these people are now, some are in UK, some are in the US. Well, a few of them have gone back to their countries like Tanzania, Zimbabwe, but you have quite a number of a high rate of brain drain. And this is the issue in terms of the challenge. It's not that we don't have the skill, the capacity is there. And some of these students, you'll be shocked in terms of their background, very poor in terms of, but we hold their hands and they develop this, and quite a number of, if not all, their research projects. These are published. I think I will share with you towards the end of the presentation. So the skills are there. It's just a question of, in terms of how the support to sustain such activities. As I said, we have quite some advanced, some basic equipment in terms of analytical processes, but in terms of maintenance, the there are quite a number of them high maintenance, like ILCMS and GCMS. These you need to maintain these from time to time. So in order to make sure that you have the necessary equipment to conduct these activities. I mentioned earlier on retention of postgraduate students. There's this a brain drain, and it's part of human nature. They go to where the grass is greener for them. But what we need is the support in terms of to sustain these laboratories. Next, please. Over the years, as a result of what we have shown that we can do in our laboratory, UNIDO, United Nations Industrial Development Organization, engaged our lab as a training center for the low-income developing countries and SADC. It is involved in terms of analysis, training them on capacity building in terms of how to use some of the equipment, but even as basic as even sample collection for POPs analysis. And there was opportune that one of the, I think 2 countries were identified. One was Ethiopia and the other one was Sudan. We went there to actually train them in terms of how to collect samples, from basic sampling procedures to analysis. Of course, the samples were brought back to our lab and we did the analysis. But this was when Dr. Mohammed Issa was still alive. But since then, the program has more or less fizzled out since his departure. But this was in recognition of what we have been doing on POPs analysis. Next, please. So in terms of, again, I talk about support, about inter-laboratories. We have been opportune also that we have participated in the second UNEP, I think second UNEP inter-laboratory studies. I think that's in the next slide, please. Yeah. And I think we looked at the PBDs, and this was in breast milk. I don't have the result here, but I mean, if anybody wants to share that, I can arrange for that. So we have, our laboratory has also participated in the UNEP second round of inter-laboratory. And this is as a result of what we have been able to, or we have been doing in terms of POPs analysis. Next, please. This was the work that we just completed. I mentioned earlier on with respect to PFAS. We were able to actually approach this by what is referred to as non-target, as well as the targeted approach. And I'm quite proud that we have been able to publish part of this research in environmental science and technology, water, with Dr. Abafe, who is going to talk next. So the output from this is quite encouraging, and we were able to identify during non-target new PFAS compounds, those ones that actually haven't been listed, as well as the legacy ones. This, if you can Google this, Water Research Commission of South Africa, you see this in terms of this output. So, and as I mentioned earlier on, we're still continuing with PFAS in various environmental samples. Next, please. Yeah, these are some of the. This is just a very small output that I wanted to share with you, but there's quite a lot that if you Google, that you see quite a number of some of these that we have published. As I mentioned, that the major hiccup or the major problem that we face is not I don't think it's a question of capacity building. Not that we don't need it, we do need, but if we can support even the little that we have, we will have that sustainability. And in terms of where people, some partners in Europe, that they want some samples to be collected, what that can be, you will see a sort of a sustainability and interest in terms of what the participant from this side, the interest will grow, because I've observed that over the years, when you take the students out into conferences of international standard, and when they come back, there's a completely new change. That exposure, encourages them. So what we need more is the support to the little that we have at the moment, to support in order for it to be sustainable. And we can do quite a lot with the little we have. We've been clamoring for this. I think that is in the next slide, please. Yes, okay. I think this is just my contact. We've been clamoring for this over the years at various dioxin conventions. I think we wrote a sort of a concept note that if we can get the support and identify laboratories, either regionally, where some of these samples can be sent. One is that it's a lot cheaper to do it even within the continent. A typical example is the work that we did for Basel Convention. It was 5 countries, and samples came in quite easily, no problem. And it's a lot cheaper, and the work was done. And it's the same methods that probably our counterparts in Europe and North America use, that we use, the same equipment. So all I'm just saying is that, yes, we need to build the capacity, but at the same time, we need to support the capacity we have at the moment in order to sustain. And it's through that we actually begin to attract a number of people, that potential researchers or analysts that will take over from the elderly ones. And then that would also reduce the brain drain, where people now, once they get their degrees, and they probably might completely go into different areas. So with that, I thank you very much for listening, and I hope that collaborations will, this will enhance our collaborations and stimulate more collaborations if need be. Thank you.
Yes, thank you very much, Professor Okonkwo. I mean, also for the capacity you have built, not only for the presentation. And great to see that you could support the national PFAS monitoring. I think there is, for other 53 countries in Africa, also the need for national PFAS monitoring. So hope that you might be involved in future also in some other countries for that work. So our next speaker is Professor Gan Zhang from Guangzhou Institute of Geochemistry, the Chinese Academy of Science. Professor Zhang has a Belt and Road POP monitoring research project in different world regions, including Africa, Asia, and South America. Please, Professor Zhang, give us some insight in your research, including Africa.
Thank you, Roland. Thank you for inviting me to join this roundtable discussion. I think it's quite a good opportunity for me to introduce some of our activities and also opportunities for POPs research in Africa and other developing countries. My name is Gan Zhang. I come from the State Key Laboratory of Advanced Environmental Technology of Guangzhou Institute of Geochemistry, which is one institute of Chinese Academy of Sciences. Next, please. Yes, we all know that POPs is a global environmental challenge. Why it's global? Because the POPs can travel from here to there. And if we look at the key drivers of global dispersion of POPs, the first is natural transmission via atmosphere, by water, or by migration birds and other biota. And for the nature transmission, a general concept is that the POPs can be evaporated from the global south from the low latitude regions and then being condensed in the colder places, such as the Antarctic, the Arctic, and also the Tibetan Plateau, or even the high mountains in Africa. But in that means, what about the warmer so-called global south? Next, please. I think, sorry, go back. Yes, I have a time lag. Yeah, okay. So for the global south, I think 4 issues are very important. The first one is the global redistribution of industrial capacities, moving from more developed countries to less developed regions. And the second one may be the global transfer of solid waste, like electronic waste or plastics. And the third one is a global trade of commodities and food, something like a salmon fish, and also various kind of industry products from the producers to different kind of consumption countries across the world. And the last one is, we all know that it may be the exemptions of some of the POPs application in certain developing countries like DDT for malaria. Okay, next. Yeah, this is just an example of a global redistribution of industry capacity of P4AS. We look at the right picture, we can see in the year around 1990 to the year of 2000, the production capacity of P4A are mostly in North America and Europe. But by now, the year of 2020, most of them are produced in China. So it's a kind of a shift of industry capacity from developed countries to developing countries like China. Next, please. I'm sorry, I have a time lag. Okay, it's okay. I see it. And this is another example about the global transfer of solid waste, in particular electronic waste and plastics. To the left, you can see the global path for the transfer of this electronic waste at global scale and at Asian scale. If you look at it carefully, you can see that they are transport along the seaside or the coastal line, because most of the waste, they are cheaper and compared to industry products, they need to be shipped in a relatively inexpensive way, which means shipping is better. If we look at so for the receiving countries or cities like Accra in Ghana, and also like Guiyu in China, many years ago in China, but Accra, Ghana, at the moment, they have some high superimposed POPs contamination in the environment. Next, please. It's moving, okay. And this is an example of the transfer of POPs by global fish trade. It's a work done by one of my very good friends. And they examined the global trade of salmon fish, or global fish trade. And then there are POPs inside of the fish body, in the fish food. And then they do the mass calculation to see the transfer of the health risk in the meantime of the global fish trade. What they found in Africa is that the PCB concentration in Africa environment is quite low. However, in the human breast milk in Africa, it's very much high. According to this study, they show that actually this may be caused by the seafood trade from the salmon fish coming from the Western Europe to the Africa. So this is a good example. I like it. Next one. Yes. So I have my very strong personal interest in looking at such kind of processes, along with the transfer of industry production capacity of electronic waste, plastic waste, and also maybe of fish, fish trade or other commodity trades. So in the year of 2018, I have a project. It's called the Southern Contaminants Program, because all of you know there's a Northern Contaminants Program in Canada. They focus mostly on the colder places like the Arctic, but this program has been more focused on the global South. Next, please. Yes, this is I just share with you some of the quick snapshots. So we set up the passive air sampling network covering 19 countries or regions, and including 45 cities. You can see some of the cities on the map. A total of nearly 400 passive air sampling air samples was collected during this kind of, we call it a global campaign. We used the passive air sampler invented by Tom Hanna of Environment Canada. Okay, next, please. And I just show you some of the snapshot by this program. This one, we can see the PCBs. We analyzed all the 209 containers of PCBs in the atmosphere of the 20 developing countries in over 400 samples. What we can see very straightforward here, the highest concentration was found in Ghana, including Accra and including Kumasi. I'm sorry, because I know Asante, Dr. Asante is here. Yeah, we collected with Asante. I didn't know he's coming to this roundtable discussion. Very nice to see him. And one of our colleagues, his colleague, has been my PhD student. And William is going to, I think he will get his PhD degree in a few days later in Wuhan. And for these PCBs, you can find the highest is in Ghana, and the second is in India. I think we have been focusing on India for many years, and we know this may be related to the ship breaking activity in India, and also the third one is Myanmar. I found one Myanmar colleague is on the table, and I don't know why the PCB concentration in Myanmar is such high. Next, please. Yes, if we look at the PBDE, the highest, Ghana, the second one, India. For the novel brominated flame retardants, the highest is India and Myanmar, and the third one is Accra of Ghana. For short chain chlorinated paraffin and the middle chain chlorinated paraffin, we can see it's less. How to say? It's not that it's relatively homogeneous, but we can see the hotspot is in Ghana as well, and also in India as well. And for the DDTs, we can see the highest concentrations are in Bangladesh. Maybe DDT is still in use for malaria control or hygiene purposes in that places. And we have Professor Habib from the University of Dhaka working with us. He's now staying with me in our laboratory. And the second one is Iran. I just give you some, share with you some very quick snapshot. Okay, next, please. Yes, we also are very happy to collaborate like Dr. Asante in Ghana. It's also on the table. And those are his colleagues. Mr. William Archer is working with me now in our laboratory. And we use passive sampler to collect air samples, and also set up an active sampling station in Accra to look into the POPs contamination in the atmosphere of Ghana. Next, please. And this is another tailored study organized by Dr. Rose Alani from University of Lagos. So she set up passive samplers in many places in Nigeria, and then he wrote a paper. But the first paper is on PAH, but we have more other POPs data. Rose has been in good contact with us. Okay, next. Our next activity is the so-called Southern Contaminant Program is followed by this ANSO program. What is ANSO? ANSO is an alliance of international science organizations that service the Chinese Belt and Road initiatives for promotion of shared development achievement of the UN SDG goals. So this program, I call it Moratoksa. We have three purposes. The first one is to monitor and do the risk assessment of toxic chemicals in the air and focus on air toxics, promoting the non-toxic environmental concept and clean air action. And we also try to develop a research collaboration, knowledge transfer, young talent training for green belt and road initiatives. So for this, we selected 6 countries along the so-called Maritime Silk Road, MSR. The current key partners, including University from Pakistan, and University from Sri Lanka, and Dhaka University of Bangladesh, University of Malaysia, and CSIR of Ghana, which is in charge by Dr. Asante, and also University of Nairobi, Kenya. We worked with the Nairobi University. Next, please. By this, we set up active air samplers in these 6 countries. Okay, here I can share with you some of the slides that people are working in different countries use the PAF X80 PAF cartridges to collect POPs, both in the particulate phase and also in the gas phase in 6 cities in the 6 countries. Okay, next, please. Yeah, here I show you some quick data. We just submitted it with Roland as a co-author and Dr. Asante as a co-author. Yeah, by this we focus on hexachlorobutadiene HCBD, which is a UPOPs. It's mainly emitted from petrochemical industry. As we can see to the right plot, that the highest concentration is definitely in my city, in the city where I'm sitting in. We have even 1 magnitude, 1 degree. Okay. If you look at the vertical axis is in log scale, actually. So Guangzhou is pretty much high than the other developing countries in our study, like Accra in Ghana, Dhaka in Bangladesh, Kuala Lumpur in Malaysia, Islamabad in Pakistan, and Nairobi in Kenya. They are quite similar level, but we are very high. Okay, the next one. Yeah, in the submitted paper, we also focus on volatile methylated siloxanes, which has been proposed by some of the countries to Stockholm Convention to be listed in the list, but it's still under discussion or negotiation, I think. So most of them are used for cosmetic products. So it's tightly related to cosmetic chemical industries. If we look at the left picture, the plot, we can see in my city, Guangzhou, we also has the very high concentration compared to the other cities in other countries, and also the chemical patterns, the compositional pattern of our my city, is dominated by the congener of D4, which is quite directly related to chemical industry. And actually, the D5 and D6 of VMS, they are used in cosmetic products, but the D4 is used in industry to make D5 or to make D6 maybe. And actually in China, you can see the siloxane annual production is over 6 million metric tons in the year of 2022. So we ranked #1 in the world, huge production capacity. And in my city, we have over 1,800 cosmetics producers in our city, and we even have a small district there. The old factories there are cosmetics production factories. If you look at the beauty, the girl on the right, you can see it's a very famous Guangzhou International Beauty Expo, organized each year, open to the world. If any of you want to do business with beauty products, just simply come to Guangzhou. You got everything here. However, in the meantime, we reported very much high concentration of VMS in my city. Okay, next, please. Yes, and we also, the third activity, and also it's an opportunity for all of you. We have a ANSO training courses. We did that twice, but now we're doing the next one. The next one is expecting in September this year. It is 3 months away. The purpose of the training course is something like the capacity building for developing countries. We invite participators from all over the world, from all the developing countries, we provide hands-on training of POPs analysis in the laboratory for 2 weeks, including seminars, discussions, and also hands-on experimental trainings. So this is the theme is the monitoring and the risk assessment of persistent toxic substances in the environment in the countries along the maritime Silky Road. Okay, next, please. Yes, by this I stop talking. For collaboration interest, please contact, just send an email to me. And also, I'm very happy to see Jana here and to see Bandai Jiva. And yeah, actually, I worked together with your minister, Bode Jawad, in Lancaster in the year of 2004. So a very nice opportunity to see you. And I also want to thank Roland to give us this opportunity to meet. Thank you.
Yeah, sure. No, thank you very much, Professor Zhang, for your good studies, for supporting Africa and other developing countries. Maybe you can share the link to your ANSO workshop you are planning in our chat, if there is a link. We will stay in China and go to our next presenter, Professor Gurui Liu from Zhejiang University and also from the Chinese Academy of Science. Over to you, Professor Liu.
Thank you,
sorry
Roland.
that we are going. Wait a moment. Sorry that we are going a bit over time, but I didn't want to interfere and push presenters. Yeah, so we will take a bit longer. We have 3 great presentations left. Yeah,
okay.
Over to you.
Okay, thank you, Roland. Hello, everyone. My name is Gurui Liu. I'm from Zhejiang Normal University, and I also hold an professor position in Hangzhou Institute of Advanced Study, Chinese Academy of Study. Thanks. Next slide, please. Here is the outline. Firstly is my group. Next slide. I moved to the Zhejiang Normal University this year. Before my current university, I worked in Chinese Academy of Sciences for almost 20 years. I already published over 200 papers. Most of the papers are related to dioxins and dioxin-like compounds or industrial sterile gas emissions or some pollutants. And also I chaired over 15 research projects supported by National Science Foundation of China or Ministry of Ecology and Environment of China. I have one assistant professor for master and one PhD students in Zhejiang Normal University, and also in Hangzhou, I have 12 master students, one PhD students, and one postdoc, and I also have 3 PhD students in my previous Chinese Academy of Sciences, and totally in my group there are about 24 persons. Next slide, please. My research interests regarding the target plants, target pollutants. My target plant pollutants includes dioxins and dioxin-like compounds, for example, PCB and polychlorinated nathlines, PCN, and some brominated dioxins, and also HCBD. All those POPs are unintentionally produced during some industrial processes, for example, the waste incinerations, metal smelting plants, and also some new POPs with structure similar to that of dioxins was also focused in our group. For example, the halogenated carbenzols and also halogenated PAH. Next slide, please. And here is a picture shows my research interests. Firstly, is the sources of POPs, for example, the waste incineration and metallurgical smelting plants, and also some chlorine-involved chemical plants, and also the occurrence profiles and environmental behavior of POPs, especially in the air, soil, sediment from the remote areas and the urban areas. And also we have done a lot to food samples, including the fish, meat, eggs, milk, legumes, cereals, vegetable, potatoes, and the PCN in the 8 categories of dietary food was determined in our lab. And also we collected we collaborated with the NIS in China to do the PCN in the human milks. Next slide, please. In my lab, we already collected many of the industrial samples, for example, the sterile gas samples and fly ash samples. We use the isokinetic sampling technology to collect the sterile gas samples. Here is some field photos. We collected the sterile gas in the industries. And totally we collected over 120 industrial plants in China, and those results included dioxins, PCB, and PCN, and other unintentional POPs. Next slide, please. And also, we collected some air samples from urban cities and remote area. We used the high volume air to
Professor Liu, I think we have some issues with the audio on your end. Could you please double check your microphone once again? Thank you.
Muted. We maybe unmute and maybe stop the video. Otherwise, Anastasia, you move forward to the next presenter, and we see when Gurui is again with us. Yeah. So the next presenter is Dr. Ovukurove Abave. He's actually the former PhD student of Professor Okonkwo and moved to the UK. And now he's doing research in Africa from Brunel University in London, United Kingdom. He's from Nigeria. And over to you, yeah, Dr. Abave.
Yeah, no, thank you, Roland. Just for clarity, Prof. Okonkwo is my mentor for a long time. However, he wasn't my PhD supervisor. My PhD supervisor is Professor Biche Martin-Shi at the University of KwaZulu-Natal.
Yeah, you can go ahead.
All right, so good afternoon, everyone. Good morning, good evening, depending on where you are in the world. So today, we'll be talking about the state of PFAS exposure in Africa. Like Roland mentioned, my name is Ovukurove Abave. I work at Brunel University of London as an assistant professor in environmental sciences and toxicology. Previous to this time, I was the head of the National Reference Laboratory for pesticides, antibiotics, veterinary drugs, and chemical contaminants in food in South Africa, which was housed at the Agricultural Research Council in Onderstepoort. So my work over the years have centered around brominated flame retardants, pesticides, and over the past 5 years on PFAS exposure in Africa. So for the purpose of time today, I'm going to focus on the work we've done on PFAS exposure in South Africa as a case study for the African continent. Next slide, please. So the first question is, how much do we know about PFAS production on the African continent? Alluding to what every other presenter have talked about today, there is very limited knowledge or official records that is accessible to scientists on the production of PFAS on the continent. However, we do know that in South Africa especially, compressed air foam systems are in production, and various aqueous film-forming formulations and concentrates, which are precursors for PFAS or heavily laden with PFAS, in trade or in commercially available on the continent. And very importantly, we have issues related to international export of products. Next, please, international export of products that contain PFAS, such as issues related to exports of commercial and consumer products like firefighting foams or raincoats, which comes into South Africa. Next slide, please. And next, okay. On the regulatory aspects of PFAS and across the African continent, other presenters have also mentioned about this. There is not much that is known about, there is not much legislations that are available on the continent, although a few countries have got national guidelines or implementation plans, like South Africa have the South African Government Gazette number 42693, which stipulates the phase out of PFAS, and it's sought by December 2021. Kenya's National Implementation Plan also recommends the monitoring of PFAS in the environment. However, we would all know that these guidelines and legislations are mostly fragmented, and in some cases, enforcement is very weak across the continent. So the next question that we're asking ourselves is, how much then do we know about PFAS exposure on the continent? Next slide, please. So as of this morning, there are generally about 75 peer-reviewed studies, which is reporting on PFAS exposure on the African continent. Many of the studies are review articles. Some are there that reports on PFAS in wastewater, a few studies on dietary intake of PFAS, and very few studies on population exposure. So what we notice is that there is strong research gaps when it comes to the aspect of inhalational exposure to PFAS, as well as the dermal contact or dermal exposure to PFAS, which are some of the recognized routes of human exposure to these type of POPs. Next, please. And so what have we done so far? So the first question, or the first answer we wanted to provide on PFAS exposure on the continent was a study that was funded by the United Nations FAO in conjunction with the International Atomic Energy Agency under the African Regional Cooperative Agreement for training and capacity building on nuclear-related techniques, which was funded from 2017 down to 2021. So the first thing about this study was to understand the exposure or the occurrence of PFAS in marine living resources, which is a highly economical marine life or marine produce for South Africa. South Africa as a country currently do produce about 5,000 tons of marine living resources, mostly composed of abalone, mussels, lobsters, and oysters. About 70% of this production are destined for international markets. And for there to be a flow of market, there must be monitoring data in order for South African to be registered under what we call the National Residue Monitoring Program for developing countries in order for them to assess trade with their trading partners across the world. So in this study, we did a preliminary investigation of PFAS in farmed marine shellfish. And as you would see in the graph to the right-hand side, or maybe left on your side, you can see that PFAS is highly distributed among these organisms, from abalone to mussels to lobsters to oysters. And these occurrences are mostly characterized by the short-chain PFAS, mostly PFPA, PFBA, and PFHPA. So the next big question about this is this presence of PFAS in these organisms, are they presenting human health risks to consumers? Fortunately, South Africans do not consume much of marine living resources. Hence, most of the market is destined for international purposes. So when we did our human exposure assessment or dietary intake assessment, the levels that we were taking on daily basis in South Africa at that time were generally below the recommended daily dose. Hence, at this time, this was assumed to be a negligible risk to human health. But then we decided to take this a bit further to look at other human exposure relevant matrices. Next slide, please. So we took the study a bit further to look at other human exposure relevant matrices, which is mostly milk, which is consumed heavily in South Africa, and then infant formulas, which are consumed heavily again in South Africa, with many babies relying on only infant formulas at their developmental stages. So again, you will see the distribution of POPs, of PFAS in the milk samples and the infant formulas. You can see that the profiles were mostly characterized by long-chain PFAS, and then we still have a bit of short-chain PFAS characterizing the milk samples. So again, when we carried out exposure assessments, looking at dietary intake of PFAS arising from intake of infant formula, what we found out that the babies that are exclusively reliant on infant formula are exposed to levels that are slightly above the dietary required guidelines. So again, we took this a bit further than this and see other human relevant exposure matrices. Next slide, please. So in collaboration with Professor Jonathan Okonkwo, we did an extensive study on PFAS in South African water system. But for the purpose of today's talk, the focus is going to be on drinking waters in South Africa. So this was we started this with non-targeted screening, where we identified about 70 PFASs in drinking water and other water sources. Of these 70 PFAS that we identified, about 5 of them were new that have never been reported anywhere before, but we found them in South African drinking water. And very importantly, in the tap water, which is the top of this graph that you see here, what we found out is that the average concentrations of PFOA and PFOS, as well as PFNA and PFHX, which are the regulated PFAS under the US EPA, the average concentration we found in the South African drinking water exceeded the maximum contaminant levels for this class of this type of PFAS in South African drinking water. This is a strong concern in terms of human exposure. So again, we carried out this, we furthered on this study to see what the impact of PFAS is in the human ecosystem. I mean, looking at the concentrations of PFAS in humans and see if these concentrations that we've measured in environmental samples and in food matrices do have any implication for accumulation in human. So next slide, please. So we developed the first preliminary human biomonitoring program for PFAS in pregnant women in South Africa. Very importantly to measure is that this is a very small cohort of about 70 pregnant women, mostly of similar socioeconomic status. Next slide, please. And next, press it again. Okay, so we collected blood samples from about 70 women. These blood and breast milk samples from about 70 women of the same or similar socioeconomic class. We measured the PFAS concentration, the concentrations of 15 different kinds of PFAS in their system. The blue bar here represents the breast milk, while this lemon kind of color bar represent the concentrations in serum. So you will find out that, go back to the other slide, back please. You'll find out that the concentrations of PFAS, the short chain PFAS dominated the breast milk, whereas short chain and long chain PFAS dominated the breast milk, whereas PFAS specifically was very high in the serum samples. So when we quantified again dietary intake for children who rely strictly on breast milk, we found out that the short chain PFAS, including PFOA, present significant risks to kids that are exclusively breastfed. However, in the serum concentration, even though for PFOS that the levels are relatively high, we did find out that the concentration of PFOS in the serum of pregnant women in South Africa was generally less than the global median serum PFOS concentration. So, but again, like I mentioned earlier, the cohorts in this study were of similar socioeconomic class, which are economically deprived, deprived population. We all do know that studies have shown that PFAS concentration, internal concentration, it's usually proportional to the levels of affluence, wherein the more affluent people do have higher concentrations. So again, it's necessitates the need for extensive human biomonitoring studies for PFAS and other POPs across the continent. If you go on the scientific literature, you will see that very, very few studies have done carried out any extensive study on the a true picture or a true reflection of the exposure of the African population to POPs. So this is a significant research gap, because if we do not know the concentrations that are in our system, it is very difficult for us to identify how this drives our health. We do also know that there is been concern about issues related to cardiometabolic diseases across the African continent, which is on the rise on daily basis. We do not understand at this time how our exposure to POPs are driving these increase in cases of cardiometabolic issues. So it's very important that we address these parts of a research gap. Next slide. So before I focus on this, I would like to mention that all of the studies that I have mentioned, the monitoring, the analysis, were entirely carried out at the National Reference Laboratory in South Africa, which is based in Pretoria. This was never done in the UK, where I'm currently is. So it shows that there is some levels of capacity in the continent, especially in South Africa, where facilities are in place to undertake some of these studies. And just to talk a bit about previous successes that we have had in terms of training programs, this is stemming out from some of the shortfalls that Yana had mentioned, and Bondi also mentioned, in addition to Jonathan mentioned. So some of the shortfalls some of the successes we had with a project that was coordinated or funded by the International Atomic Energy Agency. It was strictly a food safety related project, which it was termed as the African Regional Training Program for Capacity Building on techniques related to nuclear technologies. So under this, we identified, this was funded from 2017 to 2021, and I happen to be one of the CSI, which is Chief Scientific Investigator, where I carried out a comprehensive training program for about 18 African countries on food safety analysis and control, including quality management system. So this program led to the ISO 17025 accreditation in about 5 countries, including the Botswana National Veterinary Laboratory, the CEST National Veterinary Laboratories, and other national veterinary laboratories across the continent. So this is an approach that we can take, especially when it comes to POPs analysis, having a coordinated kind of program where national facilities are trained to be independent, and then there should be a kind of information flow within this. So one other success of that program was the establishment of the African Food Safety Network, where national capacities across different countries do have direct contact with other national capacities, where in case they have analysis need, it's just a click on a Telegram channel or on the website that is hosted today by the IAEA, a click, and then you say, is there any lab within the continent that has the capacity to do, say, chloramphenicol analysis, a confirmatory analysis for chloramphenicol? So if there is any country that is close to that country, they just indicate, yes, we have the capacity, our method is accredited or not. And then that can be arranged. So issues of shipment of biological samples outside of the continent was sort of stemmed with this approach that we recorded with the African Food Safety Network. So this is an approach that we can also take with regards to POPs in Africa. So at the Brunel University, we have established a new master's program, which is basically about environmental pollution and monitoring. And this is a practical-based master's program, which offers up to 25% scholarship for people who are interested in having hands-on training in non-target screening, targeted analysis, exposure assessment, chemical toxicology. And yeah, our work on the African continent still continues, especially when it comes to interrelating external exposure from the environment into the human body burden of POPs. So we keep on looking at the indoor environment, the food chain, and then directly relating them with their concentrations in human and how they influences the health of the continent. With that, I would want to say thank you for your attention. Next slide, and to my collaborators across Africa from the ARC down to Randwater, and to Roland and the organizers of these meeting today. Thank you.
Thank you, Dr. Abave. And maybe to Professor Okongwu, I think that you see there is also a benefit if an African researcher go out again and establish his own group, because Dr. Abave is interested to further support research in African countries by cooperation and capacity building. Maybe Dr. Abave, you can share in the chat also maybe some links where to apply. Yeah, maybe also to the African Food Network. I think that was also very interesting. Then we come to the Professor Chun Huang from Tsinghua University. This is also at the same time Stockholm Convention Center for Asia and the Pacific. The reason we invite Professor Huang is that he is one of the most experienced scientists on PFAS monitoring in firefighting foam. And this is a quite important matrix, which is relevant for Africa. I have not seen any analysis of firefighting foam from Africa, but at the same time, I think it is very relevant for the African continent. Over to you, Professor Huang.
Thanks very much, Dr. Weber. Yeah, it's my pleasure to give a short introduction about our experience about the PFAS analysis in Class B firefighting foams. I would focus on the methodologies available and our practice, basically under the framework of a GF project focused on the reduction and phase out of PFAS in China. Yeah, next slide, please. Yeah, why I use the term Class B foam instead of the AFFF, because actually, if we wanted to track the existence of PFAS in the foams, we have to expand the scope, not only the AFFF and the ARFFF. We also have FP, ARFP, FFP, ARFFP. Yeah, we have so many different formulations. All these formulations contains PFAS. So I just use this term. Yeah, I believe most of the colleagues here know the mechanism of the Class B foam. Yeah, so I will skip the mechanism explanation. Next slide, please. Why we needed to understand the PFAS profiles in firefighting foam, because we can think about the safety of our drinking water. The firefighting operation will release the foam wastewater into the environment. The current wastewater treatment process basically does not make sense for the removal of PFAS from the wastewater. So they have the chance to enter into the drinking water source. Unfortunately, the normal process for the drinking water production is also difficult to remove the PFAS. So we can imagine finally we will got the PFAS in the tap water. So we have to understand the PFAS profile at the source. This is one concern. The other concern is if we think about the phase out of firefighting foam containing those dirty, those legacy PFAS like the PFOS, we needed to identify the PFAS in the foam obsolete wastes. So in this case, we can dispose of these wastes properly. So this is the other concern. Next slide, please. The PFAS in the form, actually, this is a long story. We can see since the year 1963, it is the U.S. Navy who patented the first PFAS containing HFF, and then it's quite interesting to see that 2 years ago, the U.S. Navy have changed their military specification for the forms from the fluorine containing foam to the fluorine free foam. So this is a changing story of 60 years. Then we think about the possible occurrence of PFAS in these forms. We can see that actually it's quite complicated a story. We can see the ECF-based technology, which means the PFOS or the short chain isomers are being used at the beginning. And then we can see those fluorotelomerization process have been used. And then we have the short chain technology. Also in some countries like China, we also have some special organofluorine surfactants have been used, such as OBS. So it is an easy question to ask what's the PFAS in the foam, but actually it's not so easy to answer. So we need some technologies for the monitoring purpose. Next slide, please. Here we can see there are some regulatory limits existing in different countries. For example, in EU, we can see the POPs regulations. There are several numbers for the limits. Also, we noticed that 1,000 ppb for total PFAS have been proposed in the proposal in 2022. Also, in the United States, according to the new military specification, the limit will be just one ppb for the fluorine-free forms, according to their standard. Also, we can see in Queensland, in Australia, we have the detailed numbers. Okay, so the previous, go back. Yeah, okay. Next slide, please. So here on this slide, we can see those available tools for the PFAS analysis in foam samples. Most of previous studies are based on the targeted PFAS, especially using the LC-MS technology. But if we also wanted to know the concentration of those neutral PFAS, like the FTOH, we have to also use the GCMS. So this is a routine analytical method. Besides the targeted PFAS, also we need some additional technology. For example, for the precursors, we call it the total oxidizable precursors, TOP, we needed to use the heat-activated persulfate oxidation to convert those precursors into the detectable PFCS, and then we use LC-MS for the further analysis. Besides these technologies, we also want to know the total concentration of the organofluorine. So for such purpose, normally we can use the combustion ion chromatography. That means the CIC for the purpose. In recent years, there are several studies which use the HR high resolution MS for the suspect screening as well as non-targeted analysis. We can see in the literature's time of flight MS or the orbit trap, MS have been used for the purpose. From the diagram on this slide, we can understand the relationship between the methods from the results from different test methods. Also on the right corner, we can see the photos of those facilities we use in our lab. Next slide, please. Next slide. Yeah, here I want to mention a bit about the two new tools we developed. The first one is we call it the Top Plus. The idea is to significantly reduce the required time, from 6 hours to just 1 hour. The key point is to replace the heat activation by the UV light, the ultraviolet light activation. In this case, the efficiency can be significantly improved, so the required time can be reduced. Okay, yeah, next slide, please. The other one is we call it the total reducible organic fluorine. We call it the TRF, just in case the in your laboratory you have no CIC, the combustion ion chromatography, but you have the normal ion chromatography. You can try our TROF method. The idea is to use hydrated electron to convert the organic fluorine into the inorganic fluoride. Then in this case, it will be easily determined by the normal ion chromatography. Then we forget the expensive CIC instrument. Okay, next slide, please. So now I would like to share some data from the China's GF-PFAS project. Since the PFAS comes from the foam surfactants we used for the manufacturing, so we would like to focus on the concentration in the foam surfactants. On this slide, we can see those old formulations. Basically, it's based on the ECF, the electrochemical fluorination process. So here, we can see clearly that most of the surfactants we tested are based on the PFAS. After the top assay, we can see the concentration of the PFCS and PFSS basically changed a bit. Next slide, please. Here we see the R&D results from the key Chinese company who actually is the biggest vendor of the foam surfactants in Chinese market. Due to the reason of China's implementation of the Stockholm Convention, also with the catalysis of the GF project, this company actively developed the new versions as alternative. They changed the originally ECF-based products into the fluorotelomerization process. So here we can see the difference. This is a direct comparison between the old version and the new version. We can see the totally different patterns can be noticed. On one hand, we can see no any PFAS can be detected. On the other hand, we can see that the 622 FTS, this is it becomes the predominant isomers in the formulations. In addition, we can see after the top assay, after the oxidation, the patterns significantly changed. Also, the detected concentration of the PFCS increased significantly. Next slide, please. Here, we can just have a quick look at the application of the top assay and top plus assay. We can see after the oxidation, the detected concentrations of the PFCs significantly increased. Next slide, please. Here is the comparison between the direct analysis and the top plus assay. The conclusion is just as we mentioned for the previous slide. Next slide, please. So basically, if we make a comparison between the normal top assay and the top plus assay, we can see the test results are quite comparable. If we have checked the details, we can see actually the conversion efficiency of top plus is a bit better than the normal top assay. Okay, next slide. We also use the high resolution MS. In our laboratory, we use the time of flight MS for the purpose. We established the workflow for the suspect screening and the non-targeted analysis of the PFAS. We can detect more than 60 different PFAS structures in the foam surfactant samples. Here, just on this slide, I just give some examples. Next slide. Next slide, please. With the results from the targeted and the suspect screening results, we can put these data together, and then we try to use the principal component analysis, PCA, to make the comparison between the domestic formulations and those imported formulations. Then we can see it's quite interesting that firstly, we can distinguish those ECF-based surfactants and the telemere-based surfactant clearly. Also, we can see the similarity between the new version surfactant and the imported surfactant, especially from the American company, the Camus. Okay, next slide, please. Then, with the detected concentration, we can easily make a comparison with the reference regulations in EU, in United States, or in the Queensland, in Australia. Basically, we can get the conclusion at the time we publish this paper. The new version can meet the reference regulations in EU and in Queensland. On the right side, we can see the detected concentration and the patterns in various formulations. Okay, next slide, please. Due to time limit, I just quickly share the method and the results. Now I would like to conclude my talk. Firstly, we can see regulatory limits for PFAS in foams already exist in EU, United States, and Australia, which require comprehensive test method, such as targeted PFAS analysis, top assay, TOF by combustion ion chromatography. Secondly, the test methods and the instruments are well developed for the purpose. We can use CIC to test the total organic fluorine or the extractable organic fluorine. We can use the LC tandem MS to get the targeted MS PFAS concentration. We can also use the GCMS to get the concentration of the neutral PFAS like the FTOH. Thirdly, we can use advanced suspected and non-targeted analysis based on the high-resolution MS, which can provide additional information about the unknown PFAS. it will be very useful to realize the fluorine mass balance of the test results. Also, the practice in China, as a case study, we can demonstrate the substitution of PFOS-based foams to the C6, the short chain and the alternatives. Which can be attributed to China's responsible implementation of the Stockholm Convention. Also, we need to appreciate this financial support of the GEF project. Okay, that's all for my presentation. Thank you very much.
Thank you very much, Professor Huang. Like I said, I think it's very important. I mean, we saw the PFAS pollution in Dr. Abaf's presentation in Africa. But Africa also need to go to the sources, and firefighting foams are for sure an important one. So therefore, I included this presentation, and we're also discussing if it might be possible that Professor Huang will analyze in the frame of the NIP projects in Africa some of the foams. So this we can see in future. Now we have a few slides left from Professor Huang, from Professor Liu. So maybe Anastasia, can you go back to the air sampling?
Okay. Sorry for. Can you hear me now?
Yes, we can hear you. Please, continue.
Okay. I will continue from this slide. Here, this slide shows our sampling, air sampling in urban area and also in remote area, such as in the passive sampler in Ellison, the Arctic. We used the X82 to collect the gas phase of dioxins, PCB, and PCN, and so on. In our lab, we have the high volume sampler and also some small exposure sampler. It can be carried very conveniently. So next slide. Next slide, please. Thank you. Here, in our lab, go back, please. We have established the isotopic dilution HRMS methods for POPs analysis. For example, the analysis of dioxins, PCB, and PCN, and penta and hexachlorobenzols, and also we can analyze OCP in air, soil, sediment, and biota, and other samples. Here is the chromatograph of the PCN in stale gas samples. Next slide, please. We also have some high resolution GCMS, for example, the QTOF, GC Orbitrap mass, and FT-ICR mass. We can do the analysis, screening analysis of organic pollutants in stale gas and fly ash samples collected from the industries. Next slide, please. So here is the opportunities we think we can collaborate. For example, the capacity for POPs analysis, especially for the dioxins and the dioxin-like compounds, for example, PCB and PCN. We already do some training for the sampling, pre-treatment, and the instrumental analysis for some a lot of environmental researchers from from China, Iran, and Bangladesh, and so on. And also, we would like to do some POPs analysis for the foreign countries, because some much larger sample number would be very helpful for the study of POPs monitoring. And also, we can share some dioxin monitoring data from industry activities, for example, waste incinerations, non-ferrous metal smelting plants, and steel making plants, that might be helpful for combined dioxin emission inventory, and also exchange and visitors are also welcomed. Next slide, please. Okay, here is my email. Thanks for all your attentions. That's all. Thanks.
Thank you very much, Professor Liu. And I'm happy to hear, that you are interested in supporting research, POP research in Africa. I know that in your new university there is a center, an African center. And I mean, we have seen that there are now 3 laboratories in Africa which are just starting dioxin. So therefore, there will be for sure opportunities for you for cooperation, and also for African laboratories. So yes, sorry that we went quite over time, but I think everything what the presenter said was very important. Yeah, if there are further comments or inputs, Jana, at one point you raised your hand before. If you want to add something, you are very welcome. Yeah.
Thank you very much, Roland. I really enjoyed the table. And I think many of the participants confirmed what I said at the beginning, that that is very important to network, to bring together the capacities, to link the monitoring with the local capacities of the laboratories and make a plan for sustainability. And this is what I was complaining at the beginning, that, when we started with the African monitoring program, we were hoping to start something that will be taken over by, local laboratories, but we so far we're not able to really do it. So one thing is really supporting. I was so happy to see so many important laboratories that are building the capacities. If we can bring them to this IRIN network and, let them benefit from networking, learning about the new methods, learning from the training programs, that would be great. And if we can bring them also to the global monitoring program, this has always been the goal, to build the local capacities. And we just need to develop more consistent plan for the future GEF projects to make sure that we continue building the capacities that are already there, rather than jumping from left to right and finance different facilities in different programs. I was also very happy to hear about the human biomonitoring program. That's another thing, because the International Human Exposome Network is now building a lot of new capacities. They are looking for the African partners. There is a big overlap between the chemical exposure and human exposome. So we just have to somehow set up the network and keep going.
Yeah, Jana, thank you very much. Actually, Professor Borhan sent me a message that he's interested to be linked to you. So I will make an email afterwards and link you with Professor Borhan from Tunisia. He's also experienced in European Horizon project, so maybe there could be a possibility. His national laboratory from Tunisia. I think there was also a question from Francis Kihumba. So we have put you here. So if you unmute your microphone, Francis, you can speak. If you wanted to say something. Yeah, Francis? We cannot hear you at the moment. Yeah, maybe if we cannot hear, then you can type. I have seen there was a question from Elham from Egypt about egg monitoring. My recommendation about egg monitoring Egypt would be that you link to Jindřich Peterlik from Czech Republic. So maybe he will support you in that monitoring. Also, there was another question from Mufano Kosi, quite difficult name. You were asking about participation. I think you mean GMP project. So normally the GMP project continue with the countries they have started. But maybe you can ask, I mean, if you are from the government to UNEP Geneva, to Haosong, we can provide the email if it's possible to add a country or how a country which is at the moment not in the GMP might get kind of linked to GMP activities. And you have also seen, you know, there are a range of laboratories, yeah, here from Czech Republic over Brunei University to South Africa, and now the upcoming dioxin laboratories where you could be linked and get some analytical support in future. So I think, Francis, we cannot hear you, unfortunately. Somehow your microphone is not working. So either you can type in the chat what you wanted to say, or afterwards you can contact us by email, and Anastasia or I will reply. So thank you very much for everybody, including the translators, yeah, which also stayed over time. Yeah, we got good feedback, and I hope that our roundtable could, yes, enhance networking, also networking in future. And we will have in 1 week a session on Asia with the roundtable. So you can also join on 17th and register if you are interested in that roundtable, and get information more from Asia. Yeah, okay. So from my side, that's all. Anastasia, do you want to kind of end, or do you have to say something?
Yeah, thank you so much, everyone, for staying with us until the very end. We really valued this important and rich discussion, and thank you to all the panelists, the speakers, who helped us to better understand the contents, the context and the landscape of the POP's research needs and opportunities for the Africa continent. And we really hope that this can spark interest and contribute to the collaboration, not only in Africa, but beyond Africa. So thank you very much. And many thanks to Roland for sure, and to the interpreters who supported this event. Thank you.
Thank you.
Good luck, everybody, for POP research and good progress. Yeah. Bye.
Thank you. Goodbye.
Bye.
Thank you. Bye. Bye.
Bye.